This program is brought to you by cable franchise fees and generous donations from viewers like you.
So seeing a presence of a quorum of the, are we ready?
I think we're good to go. Yep.
Okay. Seeing a presence of a quorum, I'm calling to order this meeting of the Region School Committee at 6:15 p.m. on Thursday, the 26th. And we'll do a roll call attendance. And I'm just going to go by order of how I see you all on the screen. Mr. Demling?
Demling, aye. Present.
Ms. Lord?
Lord, present.
Mr. Harrington?
Harrington, present.
Ms. Stancer?
Stancer, present.
Mr. Menino?
Menino, present.
Ms. Seeger?
Seeger, present.
And McDonald, present.
And seeing the presence of a quorum of Union 26, I'll call Union 26 to order at 6:16 p.m. and we'll do the same round the horn roll call for present. So Mr. Menino?
Menino, present.
Ms. Hall?
Hall, present.
Ms. Stancer?
Stancer, present.
Ms. McDonald?
McDonald, present.
And Demling, present. So our first item is a joint item with Union 26 and Region. So Chair McDonald, do you want me to drive this one or?
Please do.
Okay. So our single joint item is potential vote contract extension for Assistant Superintendent Doreen Cunningham. So just to back up one bit, so Union 26, just for those following the bouncing ball of committees at home, is a superintendency union. It's a committee between elementary districts of Amherst and Pelham, and so it allows us, even though we're separate districts, to share central office services and personnel. And so we come together to look at and vote on things that affect both. So typically superintendent, finance director contracts, and in this case, the assistant superintendent contract. And so what we have before us is a proposed contract extension for Doreen Cunningham, our current assistant superintendent of diversity, equity, and human resources. We reviewed this document in executive session last week. And now we're reviewing it and discussing it in open session. And if we wish, we can take a vote on it tonight. And it will require a vote of Union 26 as well as the Regional School Committee. Before I open it up for comments, is there anything that Chair McDonald or Dr. Morris you'd like to say? Yes, Dr. Morris.
Sure. And so just as per policy, the school committees have to approve the contract of certain staff, as was stated. My job in this is to make a recommendation to the committees. My strong recommendation is that Ms. Cunningham's contract be extended. I want to thank and acknowledge Ms. Cunningham for her work throughout the last few years, and I just greatly look forward to continuing to work with her. She's a close partner for me, and I take great in the words are not with me tonight, and I got to talk a lot, so I got to get better. But what I want to say is that she's been integral to the movement of the district in a positive direction, and I can see that continuing and expanding as we move forward. You know, on a professional level, I respect and enjoy working with her. On a personal level, I think she brings a lot to our central office leadership team beyond even what's officially in her job title, because there's a lot more that she does than what can be defined that way. And so my recommendation to the committees is to approve the contract that Ms. Cunningham and I worked on. I look forward to continuing to work with Ms. Cunningham on behalf of the districts.
Okay, thank you. Are there any comments or input from members of the committee? Mr. Menino.
I endorse approval of the contract for all the reasons I gave last time. I'm in favor of the contract renewal.
Thank you, Mr. Menino. Any other comments or input from the committee? Ms. Stancer?
I would just like to say that I strongly support this also. I've had two experiences. One was serving on a search committee that included her and other people from the schools. And also I had the opportunity to attend a training session that was conducted by two people from her work in the personnel part of the office. And it was an extremely well-run session and a lot of good information. It was in preparation for being on the interview committee. So they were very positive experiences.
Thank you, Ms. Dancer. Ms. McDonald.
Yes, I also wholeheartedly support and endorse this contract extension for Ms. Cunningham. It's in my short time on the committee, actually, it's probably not too short anymore, 2 years. I have been really impressed with both the presentations, the professionalism and care that she brings to the very important work that she's doing for our district and our students and our staff. And I've really appreciated when we've partnered on policy and other hiring processes. So I really am excited and look forward to continuing to work with her in the future.
Yes, Ms. Hall.
Yeah, so from my perspective in Pelham, especially on the heels of the recent principal search, we've just been really impressed and also grateful that she really understood how huge getting a new principal in our tiny town at our tiny school is. And so taking that on sensitively while also having to adjust mid-search to doing everything remotely. And then in the end, it was something like 80% of community members who responded wanted this one candidate. And it's just been this really, from my perspective, very easy process, which means that it was probably an enormous amount of work for Ms. Cunningham. So we really appreciate that. So I also very much support this.
Any other comments? So, I mean, I'll just say for my part, I agree with everything that's been said. You know, with so much uncertainty and challenges, obviously, as we see later down on the agenda, facing the district, it's so good to have this kind of security of such good leadership at the senior levels of our district for the future. I feel like securing the future leadership of the district is always a top priority responsibility of school committee. So when Dr. Morris brought this to us, I was just so happy to see that that Ms. Cunningham is engaged and excited to stay long term with the district. And you know, just some of the things that she's done so far has been so forward thinking that some districts right now are just trying to get started in light of recent events. The implicit bias training for everyone who's on a hiring committee. I think Ms. Dancer was referring to that a little earlier. The Pathways to Para program that started more than a year ago now, that allows our staff of color to become licensed teachers, provides the support for that. And that's I'm just scratching the surface here of the benefit that she's brought to our district. So I'm just so pleased to be able to do this at this time. I think it's a really great thing for us. So unless there's further discussion, I would entertain a motion from someone on Union 26 to approve the contract as presented.
I move that we approve the contract for Assistant Superintendent Doreen Cunningham that takes effect on July 1st, 2020.
Moved by Stancer. Is there a second?
Second.
Second by Hall. Any further discussion from members of Union 26? This will be the Union 26 vote, and then I'll hand it off to Ms. McDonald for the regional vote. Seeing no further comment, we'll go around the horn. Mr. Menino.
Menino, aye.
Ms. Hall.
Hall, aye.
Ms. Stancer.
Stancer, aye.
Ms. McDonald.
McDonald, aye.
And Demling, aye. So that passes unanimously 5-0. So I'll turn it over to you, Chair McDonald.
Okay, so I'll entertain a motion from somebody from the region.
I move that we accept Doreen Cunningham's contract as written starting on July 1st, 2020.
Moved by Lord.
Second.
Seconded by Stancer. Thank you. Is there any further discussion? Seeing none, we'll move to a roll call vote. But actually, before we move to the vote, just a procedural question. Some folks have joined who were not present when we did roll call at the beginning of the meeting. Is it acceptable to include them in the vote right now? Or do we need to? Yes, okay. Mr. Demling.
Demling, aye.
Ms. Lord.
Lord, aye.
Mr. Menino.
Menino, aye.
Ms. Seeger.
Seeger, aye.
Mr. Harrington.
Harrington abstain.
Mr. Sullivan.
Sullivan, aye.
Ms. Stancer.
Stancer, aye.
Ms. Spitzer.
Spitzer, aye.
And McDonald, aye. The motion passes 8-0, one abstention.
And if I could just thank the committees for the kind words, the well-deserved words for Ms. Cunningham, and also to the larger point around moving forward as a district. It feels very good to be moving forward with Ms. Cunningham and the leadership of this district, and I thank you for the support of that.
All right, so I see Ms. Cunningham's with us. I should ask Ms. Cunningham if there's anything you'd like to say before we adjourn Union 26.
I do want to thank all of you for the kind words and just even the faith that you had in my work, because I can't do it without your support, right? And so I do thank all of you for your support in me being able to help the district to move in the direction that it's moving in. And I look forward to continuing to assist us, because as I put in an email once, I wrote that we have come far and we still have further to go. We just got off a call with about 30 parents in the district, parents and guardians in the district, that they talked about how much we have done and how much they're looking forward to the continued work. So I do thank you for your support in that.
Okay, thank you. Thank you for that. Very well said. So is there a motion to adjourn Union 26?
So moved.
Moved by Hall, second. Is there a second?
Second.
Second by Stancer. No discussion on an adjournment vote. So Mr. Menino?
Menino, aye.
Ms. Hall?
Hall, aye.
Ms. McDonald?
McDonald, aye.
Ms. Stancer?
Stancer, aye.
Ms. Spitzer?
Spitzer, aye.
And Demling, aye. Union 26 stands adjourned. Ms. McDonald, the virtual gavel is yours.
Thank you. And so now, 3 minutes early, but I think that's okay. We are I'll call to order the meeting of the Amherst School Committee at 6:28 p.m. And we will do a roll call. Please stay present. Mr. Demling?
Demling present.
Ms. Lord?
Lord, present.
Mr. Harrington?
Harrington present.
Ms. Spitzer?
Spitzer, present.
And McDonald, present. And now I'll turn it over to the chair of the Pelham School Committee to call that meeting to order.
Thank you. Seeing the presence of a quorum, I will call to order the meeting of the Pelham School Committee at 6:29, and we'll do a roll call here as well. Mr. Menino.
Menino, present.
Ms. Jean-Louis.
Jean-Louis, present.
Ms. Stancer.
Stancer, present.
And Ms. Kenny.
Sarah Beth Kenny, present.
And Hall, present. All right, thank you.
Okay, so welcome everybody. We are being broadcast on Amherst Media in Amherst and live on stream. and recorded. So our first order of business is to approve our minutes from June 11th, and those minutes were in our packet. Ms. Stancer?
Oh, I move, I'm sorry, question. Do we do the corrections after the motion or before the motion?
We usually do them before, but it could be.
Oh, okay, because I do have one correction. On the top of page 6, when I was commenting about the platforms being used, I don't think I said that people preferred Moodle. Just that several people mentioned Moodle as well as Google Meets.
Okay. I'll add, I had a comment. It looked like the part of the message, the minutes got cut off in the document that we received. So further down on that same page, it continues, Dr. Morris continues to work closely with Union 28-2, and then it just ends with an adjournment. So I'm not sure what was missing at that point.
Yeah, I mean,
Dr. Morris?
yeah, I think my point there was just that continue to work with Union 28 to coordinate. You know, I don't think it was much more than that, but you're right that it seems like that did get cut off. But that was, as I recall, the intent of my comment about Union 28 is that Superintendent Culkeen and I are in touch frequently around coordination between the districts.
Great. Ms. Hall.
It looks like Jill Consolino's last name is misspelled throughout. I think it's Conselino, I believe. So in the list of attendees and then where she's referenced.
Okay. Ms. Spitzer.
On page 4 in the the fourth paragraph that starts with Ms. Kenny, kind of in the middle, it says, Ms. Spitzer asked if costs for the years will be substantial as well. And my question was whether or not the cost was for 12 weeks. So I think maybe it should read like Ms. Spitzer asked if the cost for the full year or throughout the year, but it's a little confusing, I think, as it's written there.
Are there any other changes, edits? I'm seeing none. Would somebody like to make a motion? Mr. Demling?
Move to approve the minutes of June 11th, 2020 as with suggested amendments.
Second.
Moved by Demling, seconded by Spitzer. Any further discussion? Do all 3 committees need to approve separately? Yeah, I'm seeing head nods. Okay, so we'll start with Region. Mr. Demling.
Demling, aye.
Ms. Lord.
Lord, aye.
Mr. Menino.
Menino, aye.
Ms. Seeger.
Seeger, aye.
Mr. Harrington.
Harrington, aye.
Mr. Sullivan.
Sullivan, aye.
Ms. Stancer.
Stancer, aye.
Ms. Spitzer.
Spitzer, aye.
And McDonald, aye. So the motion passes 9-0. So that I'm not doing it all again, I'll turn it over to Ms. Hall for Pelham committee vote.
Okay, Mr. Menino.
Menino, aye.
Oh wait, we need to do I need to take a motion. And sorry.
I move
First things first, I will entertain a motion before you vote on something for fun.
Move to accept the minutes of June 11th.
Great.
Second.
Okay, great. Any further discussion? All right, now the roll call vote. Mr. Menino.
Menino, aye.
Ms. Stancer.
Stancer, aye.
Ms. Kenny.
Kenny, aye.
Ms. John Louis.
John Louis, aye.
And Hall, aye.
Good. So I will, we'll move now to the Amherst School Committee approval of the minutes. These massive joint meetings are fun. So I'll make the motion. I'll move to accept the minutes, approve the minutes of June 11th as amended. Is there a second?
Lord, second.
Oh, Lord's got it.
Moved by McDonald, second by Lord. Roll call vote. Ms. Lord.
Lord, aye.
Mr. Demling.
Demling, aye.
Ms. Spitzer.
Spitzer, aye.
Mr. Harrington.
Harrington, aye.
And McDonald, aye. Passes 5-0. Great. So now we move on to public comment. And we have a significant amount of public comment to go through tonight. So we have 2 voice messages and many documents. So I'll play I'll start with the voice messages. And we'll just pull those up. We crank up the volume. Okay.
Mario Perez, town of residence is South Hadley, Mass., but I work as a teacher in the elementary school in Amherst, Mass. I'm extremely concerned about the serious decision to open the schools in the fall when there is no vaccine to protect everyone from the virus. And I'm also extremely confused as to the governor's presentation today, indicating that youth, including elementary school students, show a decreased ability to spread the virus. I'm not sure where that information came from and was not backed up by any resources. Thank you.
Next one.
Yes, hello, good afternoon. My name is Marcia Gomes, and I'm a teacher in the Amherst Regional School District, and I have serious concerns about the new DESE guidelines requiring 5 days of school, and I have concerns about the health of students, staff members, and families, and the huge responsibility that will be placed upon staff to keep the building safe for all members of the school community, considering that it is impossible to keep bathrooms physically safe under a health pandemic, and even keeping classrooms safe. That's much too much of a responsibility, and there are no guarantees, and we would be risking the health of every member of the community back and forth. With students, staff members who have pre-existing conditions, this is an unrealistic, unsafe, and just really risky plan. And I would like our administrative leaders to come up with a safer plan that is more realistic, that doesn't put the burden of everyone's safety on staff members to keep everyone healthy and safe. Thank you for listening, and thank you for making a decision that shows compassion and caring for the health as a priority for all members of the school community. Thank you.
Would you like me to bring up the document, Ms. McDonald?
Please.
These comments will be recorded for TV.
Yes.
Thank you.
Never know if my pace is right. So if ever going too fast or too slow, someone can always tell me. But hopefully that worked.
Thank you. So moving on in our agenda, next we have a superintendent's update. You're muted.
I won't start that. Sorry. I want to introduce Obed, who's on this call. You'll hear from him a little later. So we're very fortunate. He's a rising senior at Amherst College. He's really interested in education, particularly mental health. And so we're really lucky that Amherst College reached out to us and said, hey, we've got someone fantastic for you. And we said, there's no shortage of work this summer. And this is his second week, and he's already accomplished a tremendous amount, as you'll find out a little bit later when we do our presentation with an analysis of survey. So I really want to welcome Obed to the school committee. He's already been on multiple leadership team meetings, and we're very lucky to have him on board. So thank you for being on tonight, Obed.
Thank you so much.
Yeah. I actually have a little bit of a lengthy update, lengthier than you would imagine for a week after the school year ended, but that's just the nature of our world these days. And there's no rhyme or reason to the order, so I apologize for that. But one thing I want to note is we've ordered tents, or they're in the process of being ordered, 30 by 30 foot tents for all of our schools, K to 8. Our high school, we're still trying to think about what makes sense, just based in space and Summit Academy. So we're not at that place, but what we know is that outdoor education is going to be something that we want to explore in much more detail, and having a full-size tent where students can stay distanced was something really important to everyone. And so they will be here before the school year starts, and they'll be able to fit a full-size class in there. And we envision that multiple classes will be able to rotate throughout the day. The guiding principles document is out. Actually, some of the comments in public comment talked about potential models for distance learning if we have some version of that. So I encourage people to take a look at some of the guiding principles, because they actually quite well align to some of the comments that we heard tonight. We've also ordered, with existing capital funds in the Amherst Elementary Schools, 400 Chromebooks. And that's the idea that students won't be using a computer lab and sharing devices. And so we were all set in grades 3 to 6, but not in grades K to 2. So we will now have enough devices for every student in Amherst. On the mental health front, I was on a phone call today with the leaders, two of the leaders of that working group, which is Diane Chamberlain, principal of Fort River, and Dr. Brady from SSO, and Obed was also on that call with Bright, which is our program that's at the middle school and high school, but they're also experts in general on mental health and trauma. They're going to be working with our administrative team and then eventually our larger staff this year. They have a really helpful framework of how to think about what this closure and what the pandemic, how it's affected students at different levels. So more on that soon, but I did want to say that we are not waiting to think about the mental health needs that our students have faced and are facing and will face when they come back in the fall.
Dr. Morris?
Yep.
Can I just interrupt? Mr. Menino, would you be able to mute your mic? Thank you. Okay, go ahead.
As I mentioned, we have a website for fall. It's close to ready for release. I mean, it is up live, but I'll share the link in the chat. It's probably, probably by the end of the beginning of next week, it'll be fully operational. But we did want to have a website exclusively dedicated to fall return, so that people could have one-stop shopping. There are some things like the guiding principles is already on that document. Some of the survey data is already on that document that you've already seen, but we wanted to have, especially as plans developed, one site to go to so people aren't fishing around for different places to find that information. Good news, you all met Jill Consolino recently. She came and presented about PPE. I think I mentioned that we were doing our ordering before the state bid order. We went through the state bid list, but we didn't do the consolidated bid because we wanted to get ahead of it. And I'm glad we did, because about 90% of our PPE has already come in, which was a surprise. So I'm glad we were getting ahead. So thanks to her and Dr. Slaughter for getting that out. We still have some sanitizer questions that we have to go on, but there's less of a rush on sanitizer and soap and all that stuff. But our masks, our gloves, like those kind of things are all stacked here at the middle school. So we're really pleased that we have, I'd say 80 to 90%. Some stuff was coming in today and I didn't loop back and check in on it. But the vast majority of our PPE order has already been fulfilled and delivered, which is great because we were very concerned about that. We have a number of summer programs that are all being done, at least at the moment, virtually. I wanted to update you on that. Our Comandantes program, which is for Fort Rivers dual language program, has 20 students enrolled in a daily program around language. Our Title I and ELL program, which is also at the elementary school, has 102 students currently enrolled, and that number's rising. I think we'll end up about 120, 130. That's for ELL students as well as students who are enrolled in our Title I program during the school year. Our VELA program at the middle school has 30 students, and I think upwards, we're looking to get to about 40. At the high school, our credit recovery and credit program has 120 students registered, and 17 are taking 2 courses. We're expanding our health and PE offering. That's a really popular one always for students to take in the summer. It opens up their schedule a bit during the school year, so they have time, space for more electives. And so we're adding another section at a different time because of the demand. Our special education program right now is thought to be virtual. In August, we may see what elements we can transition to in person. We're still working on that. But our preschool program has 30 students enrolled. Our elementary school has 127 students enrolled, and our secondary program has 75 students enrolled. That's significantly more than a normal summer because we opened up the eligibility to get in from students who had to prove, we had to prove regression to all students who have special needs. So our numbers are much higher than they typically are. And we know that they may have been more directly affected by the closure. And so we increased our capacity that way. Additionally, and this is a more fun one of the ideas that we talked about is having a summer enrichment program for elementary students that wasn't necessarily tied to the core curriculum, but just we know how much families and students in the summer having some structure in the afternoon. Days can be a little long for parents of young kids these days. If you have some, you might be nodding, right? I am myself. And so we put out to staff to have what enrichment activities would you be able to lead? And it was for all staff. We have paraeducators, we have teachers, different types of things. And it's been incredibly popular. We have 250 elementary students are enrolled in the set of courses that we laid out. And we're really happy for us, we feel like a service, given the lack, and those are all live synchronous kind of courses. And there may be 1 or 2 that have some asynchronous and synchronous, but most of those are synchronous courses that we're offering to elementary students. So the total is over 750 students will be enrolled in our summer programs. That's, again, significantly more than a typical summer, but this is not a typical summer. I'm sorry, I got quite a bit more, so I apologize. We have purchased 2 summer books for our administrative team to read. One is On the Other Side of Freedom. Actually started that last night. It's an excellent start by DeRay McKesson. You might know him from 8 Can't Wait. So he came up and developed 8 is a protester involved in Ferguson. He's a former educator and has developed 8 research-based methods to reduce police violence and discrimination. And so that's a very well-known site at this point. And he wrote a book a couple years ago about his life and about the struggle. And also How to Be an Anti-Racist by Ibram X. Kendi. So those are the 2 books that our summer administrators will be reading this year. We did our distance learning survey. We surveyed secondary students, all families, and all staff. I think all told, there's over 1,000 responses between all 3. We're now just compiling them, something Obed, sadly for him, may be working on over the next couple of days, even though we suggested that people not put identifying information on. Some people made a mistake or skipped that part, so we have to scrub, names and things like that from the information. But at some point next week, we'll be putting those on that website when that website goes live, and I'll be sharing those with the committee for sure. Some nice overall themes across all 3 groups, actually, about next steps. So it was really helpful. I look forward to sharing that once we're confident that their confidentiality is in place. Google Meet is the program we're using right now. I'm glad to say Jerry Champagne gave me an update the other day. They're adding a tremendous number of features over the summer, including the ability to do breakout rooms. Some other things have already increased the capacity of the noise canceling, which has been really helpful because where I've been the last couple of days hasn't been work happening. And I'm amazed that my calls have not been, people are like, no, I can't hear them. And I can't hear myself sometimes of the noise that's been going on. So that's been really helpful. But I think that the breakout rooms are going to be really, really good. And, I hear that public comment feedback. On the flip side, there continues to still be issues with site security on Zoom. There's big breach this past week in the eastern part of the state. And so I'm glad Google Meets, I think technically is doing well, but it's going to add some functionality around muting and increase muting capabilities for teachers. But I think the breakout rooms is the feature I'm particularly excited about. I think my last one is just to thank AEF. They announced their grant winners, so I just want to share those here. AEF is Amherst Education Foundation. They give grants to staff members through a competitive process. The first is Climate Change Carnival. The data is real, but so are the solutions. Karita Mayfield, who works at her middle school. I won't read the full description because of time. The second is Elementary Garden Program Sustainable Expansion, Jennifer Reese. That's across the elementary schools. Logic Pro X for music production. That's at the high school. Todd Fruth, you may remember that when there was a new course request. So we appreciate AEF filling that gap and supporting that. And finally, Making History, developing students' critical thinking skills and engagement in social studies and enriching the curriculum. Ruth Kilo Hill, that's across the elementary schools as well. Thank you so much for AEF for supporting our wonderful teachers' work. And that was the longest update I've given in a long time. So sorry about that.
Mr. Menino?
You mentioned tents. Are those tents 3 feet or 6 feet distance? And is that for a full class or a half a class?
Sure. So the 30 by 30, which is 900 square feet, which fits at 6 foot distancing a full class of students. By full class, I'm talking about, 20 students roughly.
Mr. Demling?
So it was kind of related to what Mr. Menino just said, but I found those kind of real life, very detailed examples of what school might look like in the fall really compelling. They put a lot of leaves on the branches we're talking about. Do you have a sense yet for when we might first hear from all those subcommittees that are looking at the fall? Obviously, the state guidance was a big shoe to drop, and that has to be digested and folded in. But I guess schedule-wise, I'm hoping that we can start hearing from those groups before their final product is fully or nearly fully baked. Do you have a sense for that yet?
Yeah. So the process flow is those groups are done. Their job was to come up with guiding principles. Your job, mostly yours, is to develop models that we have for the fall, and then those groups get back together, or some version of those groups, to figure out how we're going to make those guiding principles real within the model that we choose. So they're sort of on hiatus at this point because the guiding principles were intended to be as flexible as possible, not knowing what model was going to happen. So at this point, the conversation turns to us. about what model makes sense. And certainly we want to talk later, and it's on the agenda, about how we engage stakeholders, including staff, in that decision-making matrix. But the goal of those groups was the guiding principles that are completed. And then, once the decision is made, we work on implementation.
Mr. Sullivan.
I know that this isn't really part of this conversation, but it's been bugging me, so I need to ask. I read that our new middle school principal is on a waiver and is not licensed for his new position. And I'm just hoping that you'll keep us informed and let us know how long of a journey that's going to be.
Yep.
Thank you.
Absolutely.
I have a quick question. So the guiding principles, did I understand? I saw it in the chat that's the link to the guiding principles, but it's not live yet. Is that?
So I'm sorry, the link is to the website, which is not live yet. The guiding principles was emailed out to all staff, and it'll be accessible through the site when we make it live. We just want to fine tune a couple of things before we have that. So just this afternoon, we emailed just the guiding principles out to all staff because we committed to doing that this week. And we'll get the site live and operational. I can get in because I have access. I forgot that we didn't turn it on live, so that's my mistake. But it basically is a very nice looking place to have lots of information so that people can have a little more one-stop shopping than searching around our website for different pieces of information.
That's great.
So I will email the committee before the evening, the guiding principles. I'm sorry that I neglected to do that. Yep.
No worries. That's great. Thank you. Any other questions for Dr. Morris or comments? I'm seeing none. Last call. Okay, great. Thank you. So moving on to chair's update. So I did want to share after the guidance and the governor's press conference today, we got significant email from teachers and staff across the districts. And not all of them, some of them were included in the public comment, but not all of them were willing to sort of be out there. So I wanted to take this opportunity to sort of summarize some of what we heard. So literally my email inbox was pinging nonstop. I think I received over 20 or 24 emails, separate emails, just from teachers and staff this afternoon. So a lot of things that they wanted to make sure that the committee was aware of and thinking of, and sort of like thoughts about the guidance and sort of our thinking and planning for reopening schools. So just to summarize some of the themes that were in there, for the most part, all of them were very, very, very concerned about the 5-day-a-week full-time in-person guidance that we heard from the governor and from DESE today. For a variety of reasons. And so just to summarize them, some of them definitely were about sort of personal exposure and their own vulnerability or their family's vulnerability to virus infection. But some of the other comments that sort of summed up, and it was across several of them, these common themes of the concern of putting the role of educators as frontline workers. And that they'll end up spending more time cleaning desks and enforcing health guidelines than sort of the true joys of teaching, as in the words of one of the teachers, and the challenges that might bring into their relationships with their students, as well as the work that they love to do. And several, I will say, many of them commented about how much they love their jobs, they love our schools, they love our students. And so this is really concerning for them. Another one is a common theme I heard was difficulty enforcing the guidelines. So again, thinking of themselves as having to be the enforcers of many of the things that are going to keep everybody safe. And comments about from folks in the schools the elementary schools about, or particularly in the younger grades, where they may not be required to wear masks. Seeing the number, knowing how natural it is for children to put their hands on their face and their noses and their mouths, and having to enforce that on a regular basis. Knowing that also in normal situations, how much they're subject to drooling or spitting or coughing or sneezing, and sort of feeling unsafe to be able to protect themselves and the fellow classmates from that. But also in terms of challenges just enforcing hoods or hats in schools right now, and sort of just regular things, questions about whether their ability to enforce the masks and other social distancing rules, and sort of again going back to that, the impact that puts on the relationship that they have with their students and each other. And then also comments about vulnerable populations that may not have the resources should their families or the student or their families get sick. So it wasn't just about themselves and sort of worrying about will they have unlimited sick leave time if they were to get sick, but also thinking about the families that may or may not have the healthcare or resources needed if they do get sick. And I think one of the teachers wrote that really stuck with me is, if you've ever been in a school building on a daily basis, one would be very concerned about the ability of the school to ensure effective safety protocols on a consistent basis. And again, the common sort of theme was sort of feeling that they were at the front end of having to enforce that, and feeling anxiety around that. So a lot of passion, a lot of emotion and concern there. And the consistent ask was also to make sure that their voices are heard, and that it's a partnership with the families and the committee in sort of planning our reopening. And so I wanted to share that. And that's all I have for a chair's update. So, are there any other announcements from the committee? Mr. Demling, and then Mr. Sullivan.
Just on a happier note, I didn't want to let June go by without acknowledging that this is Pride Month, and I just wanted to say, is from a school committee point of view, just how proud I am to have a welcoming, open community that supports our LGBTQ plus staff and students. Echoing Ms. Cunningham's comments earlier on a different topic, I feel like our district does a lot, but we can always be doing more, and we always need to be pushing the envelope on that. And I feel very grateful that we have that conversation out in the open. And a special thanks to Councillor Evan Ross for embarrassing a number of us at a community video. He definitely has proved with hard evidence that there are many of us that cannot dance and yet don't care if we're going to celebrate something like this. So thanks to Councillor Ross, and happy Pride Month to everybody.
Mr. Sullivan.
Yeah.
Oh, you got muted.
I attended the collaborative, the direct.
You got muted again.
We extended Bill Deal's, the executive director's contract through December. And the bad news is it's because he's retiring in December. So I just thought I'd let everybody know that. And it's sad. They're going to start a search in the next 3 weeks, I believe, to replace him.
Thank you. Any other comments or announcements from the committees? I'm seeing none. Okay, so we'll now move on to new and continuing business. And it's a big one. It's all related to fall 2020 planning. So I will turn it over to Dr. Morris.
Sure. So let's see. So the way the agenda reads is that I was planning to start by giving a brief update or it's hard to do it that brief, but an update on the DESE guidance that was referenced earlier. I'd like to share with OBED some survey results about the family survey about return to school. Then I think that I'll turn it back over to the chair to talk about process 2 and timeline for decision makings in the fall 2020 model and the process for engaging the public, if that sounds okay with the chair.
Yes.
Okay. So I want to share that I'm going to attempt to neutrally describe the DESE guidance. I'm not attempting to, I mean, at the end, I think it's probably worthwhile, and I'll ask some pretty strong questions, I think, of the committee, because I'm left needing some direction on next steps. But I want to be clear, this is not like an endorsement. It's not trying to be critical. It's just trying to simply take a 20-some-odd page document and to describe to you all and then to the public what I saw as key points in it. I think, one of the positive things, I guess that is a little editorial to start with, is it appears that there's a commitment for additional entitlement grant of $225 a pupil. There's roughly 130 kids in Pelham, a little over 1,100 in Amherst, and about 1,400 in the region. So that is a significant amount of money, and we'll need it very bluntly. So that is some good news. There's also a point about vaccinations for the flu and some concerns around that, and them maybe taking a harder line. But they added a couple contextual factors also, that they're tracking COVID-19, which is on a downward trend in Massachusetts, but actually an upward trend across the country. And they want us to be ready for the fact that this will definitely change multiple times before we get back in September. Their belief is that the health and safety requirements and rigorous protocols that they're putting in place, that the transmission in schools is likely lower than the risks of transmission in other settings. And that's one of their kind of key points here. And then they get into health and safety requirements and guidance. So for masks, students in grade 2 and above are required to wear a mask face covering that covers their nose and mouth. And students in kindergarten and grade 1 are encouraged to wear a mask or face covering, and face shields may be an option for those with medical, behavior, or other challenges. And that adults, including educators and staff, are required to wear masks and face coverings. And exceptions may be made based on medical conditions, disability, or impact, or other health or safety factors. They said that mask breaks should occur throughout the day, ideally outside or with the windows open with students 6 feet apart. And they'll share more guidance on that coming soon. And that masks and face covering should be provided by the student district, but that the district should have extra disposable masks. And you know that we ordered that. Masks and face coverings are required to be worn by everyone on the bus. And there's a little bit on transparent face coverings for certain staff. In terms of physical distancing, and this is probably the point that's getting the most attention, a minimum physical distance of 3 feet has been required. And so it's the language they use is should aim for a physical distance of 6 feet when feasible, but 3 feet would be the minimum distance allowed. I'll get back to this at the end, but that's the point that's perhaps the most different from the CDC guidance that we went over a couple weeks ago, as well as a report I shared with the committee from School of Public Health over at Harvard that was staying with 6 feet. And I think that I'm going to need some guidance a little bit later on that, because that is a make or break one in terms of our planning. It's hard to plan for both of those. Hand hygiene, hand washing, sanitizing. Again, this is pretty consistent with CDC guidance. Everyone, does that when they get to school. Hand washing if available, which is, at the elementary level, much more accessible. At the secondary level, that may not be as accessible given the number of sinks, but hand sanitizing in case that hand washing is not feasible. Needing to have an isolation space for students who go to the nurse's office, but where there's COVID-19 symptoms. So we've already identified where that would be in all schools. At this point, in-school testing is not required, but families should discuss testing with their healthcare provider. Says this guidance may change. Let's see, I'll skip ahead to health. Right, so now they talk about classroom and facility configuration. To the extent possible, desks should be spaced 6 feet apart, but no fewer than 3 feet apart and facing the same direction. Alternative spaces in the school, cafeteria, library, auditorium should be repurposed. safety precautions for school nurses and staff working with students with disabilities in close proximity. So all that was, that last part, that PPE included, isolation gowns, face guards, things like that. I want to pause after that. I do two more because it's a lot of information, but I'm rolling through this pretty quick, and I know it was sent out earlier. Student groups, what they believe is that elementary schools should aim to keep students in the same group throughout the day, and middle school, high school encourage to minimize mixing to the extent feasible, try to keep students in cohorts. Again, that's consistent with CDC guidance, so nothing new there. Screening upon entry, temperature checks not recommended because they don't, they're not as effective. I mean, I've read about 75%. I don't know if that's accurate, but the last thing I saw was about 75% accurate, which is not really all that helpful. But that all students and staff are encouraged to stay home if they're feeling ill. I want to pause for questions. I know I went over a lot pretty quickly. I tried to highlight things that we already talked about when it related to CDC, and then also pause when there were distinctions or differences between the CDC guidance and what DESE recommended. I have more to share, but I wanted to pause because I think that was enough for one moment.
Yes. Mr. Menino.
The claim by the committee, by DESE, that kids don't spread the virus, how well documented is that?
So I'm not a public health expert, so I want to be cautious about my perspective. I think there is some evidence I've read, and other people could jump in, that suggests that not that they don't spread the virus, but they may not spread the virus at the same rate that adults do. I think it's important to note, though, that roughly 15 to 20% of anyone who's in the building are adults, right? So absolutely need to focus on kids, but it's not like Lord of the Flies and the kids just run around and there's no adults there. That's not how our schools operate. So I think my caution isn't so much critiquing the research, it's just describing what our reality is in schools.
Mr.
On that
Demling.
particular point.
Yeah, Mr. Demling.
Yeah, I'll save most of my comments for the end, but just because we're on this particular point, the big assumption here that this entire recommendation seems to stand on, to me, is what you just, the point Mr. Menino just raised, that students are far less likely to spread and contract the virus. And with the studies that they point to, I mean, there's a number of issues, but to me, the biggest thing that jumps out at me is that, let's all think for a moment, where have kids been for the last 3.5 months? They've been at home, right? And so all these studies that we're referring to, even though people are doing these studies as fast as they can, is in a world where children have been at home, not at school. And so to use that as a comparable to conclude transmission for a virus that we are just studying seems rather confirmation bias and rather premature. So I'll pause there before I open up a whole can of on this report. But I just because we're on that particular point, that did seem to be the biggest thing.
Yeah, I agree.
And I'll just jump in to say, I totally agree on that exact point, and that's my biggest concern, because you're absolutely right. The crux of this whole recommendation is on that data that kids don't get the virus and don't spread the virus. And the studies that they cite in the actual guidance are all pre-pandemic, pre-shutdown, or before full in-person school, and certainly not an in-person school scenario that they're recommending. So it was not all kids 5 days, 3 feet apart. So it's, confirmation bias at its best. Ms. Stancer.
So I just wanted to understand, when you were talking about the funding, the additional funding, the $225 per pupil is across the state for all students regardless. It's not a competitive thing or requiring particular need.
It's a formula grant. And so that's the way I'm reading it. There's an additional grant at the commissioner's discretion for districts with unmet needs. Frankly, none of our districts, when you compare them across the state, I think would qualify for that additional grant. And there's also a grant for remote learning technology grants, but more information is coming out. But when I read the $225, and I heard it this morning from the commissioner, I have a longer conference call. We have a longer conference call with him tomorrow. My understanding is that's kind of seen as an entitlement grant.
I'll come back to Mr. Menino after other folks have had a chance. Ms. Spitzer?
Thanks. So I did my best to kind of scan the document, but wasn't able to give it a full read today. I just wanted to confirm. So we had some that initial guidance on PPE that kind of suggested that the cohort size should be around 10 kids to 2. And I know they kind of went back and said that was just really preliminary. So were there any hard numbers? I didn't see any, it didn't look like to me in terms of what the maximum cohort size should be, or was that left open to the district to decide completely?
Sure. So I'll read that. It's right in front of me, actually. So for those following along, it's on page 10 of their document. Under capacity, there are no required maximums on cohort or group sizes so long as schools adhere to the physical distance requirements above. So basically, it's the cohort size can be. It's not about size; it's about distancing. I'll get back to that a little later because I want to ask a pretty pointed question to the committee because, again, I think my team needs some guidance about direction because we've been operating on the CDC principles. CDC actually didn't have, as I recall, it really talked about distancing as well. But if the distance is 3 feet versus 6 feet, that's a markedly different number of students in a room. And so, again, I'll come back to that at the end.
Mr. Menino?
Does that 255 include school choice students?
That's a great question. My assumption is yes. But I will find out more tomorrow. I will ask that question. We were not, today's was more a heads up. We didn't have any Q&A with the commissioner. So, we got the information we got and that was it. Okay. If there's not other questions, I think the next part will go quicker, which is just what I'm responsible for and / we're responsible for. But this part's mostly me. Is that final guidance is supposed to come in mid-July, and at some point in August, I need to produce 3 fall reopening models. One, a plan for in-person learning. It says all students return in person, classroom schedules, protocols modified to meet health requirements. The second one is hybrid learning. Students learn both in person and remotely. And the third is remote learning where everybody's home. And so I actually want to comment about the remote learning. I know we'll talk about it at some upcoming meeting when we get the survey data, but what I want to express to the committee is there's a great article I think I shared with you, but I know I share many, many things, but it described emergency remote learning versus distance learning. And really what the spring was emergency learning. And I think if you look at when you see the guiding principles, you'll see that our teachers came up with much more robust ideas for distance learning moving forward. Just the context was very difficult this spring, and no staff member, family, right? No one suggesting we would do the same thing if we were in that environment next year. So, I want to be clear that remote learning, when that plan comes together, that's going to look really different than what we've had previously, because this is a lot of work's gone on, a lot of thinking, and to be able to be more robust. So I'm slated required to submit comprehensive fall reopening plans to DESE in August. I have not seen any template of what that looks like, so I can't describe it to you yet at all. This is their quote, a quote from their document. In creating their plans, districts and schools should first prioritize developing an in-person learning model with new safety requirements. They encourage us to look at external facility spaces, set up additional classrooms. One of the things that's really hard about this is that we've got, 4, and I'll talk about this a little later, but we have 4 competing demands on the operational side. We have staffing. So it's great if you have more classrooms. If you don't have the staff to teach in it, the spacing really doesn't matter. We have transportation, which we have no guidance in this document for, so it's really hard to plan without that knowledge. Facilities maintenance, cleaning. So, between Jill Consolino, Rupert, and their teams, we've been doing a lot of work on that. I feel good at where we are. And the last one, space. Those are the 4 areas where, we are directing a lot of non-instructional attention. And so, at this point, having enough spaces is perhaps an issue, but we've been doing a lot of At the elementary schools, we're actually pretty much done. We have a little follow-up work to do at one of the schools tomorrow of mapping where classrooms could go, what the square footage is, how many students can be in. I've literally gone with principals to all the schools and taken out desks and chairs and said what fits 6 feet apart. So we have a good sense of what that looks like at the elementary level. Pretty good sense at the middle school. We're starting to work on it at the high school. But the staffing piece is just the other thing. And any building we'd open needs a nurse and administrator. So adding a new facility doesn't necessarily solve all problems. So I guess that's a little bit of a critique. I'm trying not to do that, but I want to highlight that, I did talk to the town manager about the Bang Center. We maybe could get best case scenario, if everything broke right, 3 or 4 classrooms. It doesn't seem like the cost benefit is really there for that. And the colleges obviously have their own reopening that they're planning on. We're not a community not a towns that have a huge community center. So we have looked at that, but the cost piece as well as the staffing piece is difficult. One thing that I did like, so I don't sound so negative, staffing alternatives to consider for reducing class sizes. So DESE has indicated that they'll offer some flexibility on certain licensing requirements so that we have more adults who can fill more roles, especially because some roles won't be as viable. We're not having, I don't envision having staff going in 15 rooms during the day to work with individual students, right, just from an exposure point of view. So I appreciate that flexibility. They talk a little bit about hybrid models, but I think there's nothing new there. So they then talk about, to work with local boards of health. I've already been in touch with Julie Fetterman, who is the health director for the town of Amherst. She's been very helpful, as she always is. We continue to do a family survey, so we're going to present on that. So we're a little ahead on that one. Build in time in the fall calendar for training sessions. Something that I know a number of superintendents like myself have requested is a relaxing of the 180-day school year requirement. We only currently have 2 days before the school year. I think that'll be woefully inadequate. My belief is we'll also need, they say build in time in the fall calendar for training sessions. We may actually have to think about the length of the school day. No matter how many days students are in or not in, there's going to be a need for regular training on these topics as well as anti-racist topics. And that training can't happen when we don't have time. And so I think there's a lot of focus, rightfully so, on number of days in school and who gets to be in school. But I also think there needs to be some of that. There's also in the guidance a focus that in hybrid models, I think it's worth noting, we've already sort of talked about this, but just to stress that some students may attend school closer to full time, and they're talking about students with special needs, particularly in specialized programs, as well as some English language learners. Which I think are commitments everyone here would want to prioritize. Certainly I would. And then they have an appendix with a bunch of the literature and some next steps about upcoming guidance. I think I've sent you probably upwards of 10 other states' guidance, you being the school committee, I'm sorry. And, I think Massachusetts seems like they're taking the approach of sending things in waves, that, there's not one, like a lot of states have like 60-page documents, and it seems like we're going to get lots of 20-page documents throughout time. So my slightly pointed question at the end is that we're doing a credible amount of work on facilities maintenance, as I mentioned. We're starting to look at transportation. At the regional level, there's not much choice with that because we're a region and we get regional transportation. At the elementary level, we are looking at multiple models of what would it mean if we went to the state guidelines. Another community in Northampton just did this, that they're only busing perhaps a certain mileage away from the school. In the past, our schools in Amherst and Pelham have bused all students, no matter how close they live to the schools. We're trying to get that for you so that you have to consider. It's not that we're recommending one thing or the other, but we want to have you all to have as much information as you can. But I want to come back to that. We've also surveyed staff to try to identify if there are staff with health needs that would prevent them from returning. I will tell you that's a non-zero number. Obviously, that's confidential information we wouldn't be sharing in public, but the number's not zero. That I can share very clearly. And we're following up with them to assess, their situation. So HR is taking on that. We got, 400 responses from staff after the school year ended. So I think people are really paying attention to this. So, but we've been spending a lot of time on staff, as I meant, on space. And so I think we have a pretty good sense at 6 feet what we can do and where the problems are, and where if the committee wants, here's the uncomfortable part. I felt like I made a commitment to the community, that we would open school with CDC guidance as being our guiding document. There's a number of things, but particularly the 6 foot to 3 foot, that's a really different guidance piece. And so I guess I'm looking for feedback from the committee about how to approach that, because if we're going to approach it where it's 3 feet, we can redo our space sheet. It's not like it's impossible. But if the committee wants us to stay with 6 feet, then we can move forward that way. It's a little hard to do both. I will tell you bluntly, 3 feet is not much different than what our current system is. I'm 6 feet tall, so when I go like this, I tried this out with one of our principals, I can touch the person next to me's head. That's how close we are, right? And so we can, there's no doubt, I don't know about staffing, but from a space perspective, we wouldn't have issues with fitting students in those spaces. The question is that advisable, and how does the committee feel about that? And I guess we don't need a decision tonight, but I think in relatively short order, we sort of do, because it really, it changes the dynamic so much from what we've been working on and what we've been mapping. So now I'll really stop talking, sorry.
Mr. Menino and then Ms. Stancer.
3 feet is ridiculous. A normal classroom desk, they're already 3 feet apart. In fact, in Pelham School in 3rd grade, they have clusters of 4 desks. Well, that's 4 feet apart, and they're facing each other. I mean, this 3 feet is nonsense. This whole plan, as far as I'm concerned, is politically motivated for business as usual. Open the schools and send all the kids back with health precautions. This is ridiculous.
Ms. Stancer and then Mr. Demling.
I guess I would say the same thing. My feeling is that the 3 feet minimum makes it possible for putting kids back in school every day. I mean, that's really what the 3 feet is. We have seen nothing from the CDC or any other credible source saying that that's really okay. At least not that I mean, this is the first thing I've seen about 3 feet. So what do they know there that nobody else seems to know?
Mr. Demling.
All right, so I'll try and add these comments as concisely as I can. So to your question then, just to keep it focused, yeah, I don't feel like we can responsibly go to the community and say, we've been saying we're going to follow the current scientific consensus of what has been reliably proven by evidence, and then all of a sudden throw it out because we get a state document. If there was some adjustment or tweaking in one of the implementations where 5 versus 6 made a huge difference, I guess I would want to know that. But to slash it in half for no reason, and I think Ms. Stancer really hit the nail on the head there. This whole document feels like they started with the conclusion and then backfilled it with evidence. And to me, that's really the first most concerning part of this, because we can argue any one of us armchair epidemiologists about what the data currently says, but you can't argue about what the current scientific consensus strongly concludes. And it does not strongly conclude that children in closed spaces with with shared air inside buildings is safe at 3 feet as it is at 6 feet. The consent, it's just not there. It would put us as an outlier. It would put us against the CDC. It put us against every other state that I've seen come out so far. So it's based on this assumption that we're smarter than everybody else. We figured it out for some reason, and the rest of the world is off its rocker. This whole document, it feels very dismissive of staff and adult safety. There's this phrase about spacing. Remember to include space for the teacher. And I nearly dropped my coffee at that. Can you imagine coming out with a document about 20% of, like you said, the staff, people in the building, being employees, and just, I guess we shouldn't forget about those people. It also seems to completely ignore what we can already conclude about child safety, like like the first point that we were mentioning earlier, that this whole whole premature conclusion that kids don't really spread or get this disease, and all based on data of the last 3 months. And there's a whole bunch of other problems with the data, the citation. That Appendix A, I think Ms. McDonald mentioned earlier about confirmation bias at its finest. It really is quite the example of backfilling and cherry picking with evidence, a lot of which has not been peer reviewed, a lot of which dates back to February, small data sets. It's like they Googled what supports this position, which, another point I wanted to raise, and Mr. Menino raised this, it's really concerning that this feels like a political statement. It's no controversy to say that this topic of how businesses and schools should reopen has been completely politicized at the national level. It's Trump and McConnell and the Republican Party say we should reopen, and then they get pushback. And we have a second-term Republican governor, I'm sorry to say, and his Secretary of Education is Republican, and they've appointed their appointees, and so this is their approach. And so, it's just very concerning in that respect. And so, at the end of the day, I feel like the way I feel about it as a school committee recommending action on the superintendent's part, I feel like you and any other superintendent who feels like they want to speak their conscience should speak it directly to the state and say, I have real concerns about this. And I'm very happy backing you and other superintendents up that we are a committee that has committed to our community that we are going to open safely, and we're not going to railroad over what the CDC and every other scientific research is saying. And again, this isn't my conclusion versus Jeff Riley's conclusion. It's not, he can have his own opinion, and that's fine. But we're talking about what's the scientific consensus right now, especially in light of what's going on in the country right now. We're in a much different position now than we were 3 or 4 weeks ago. When you look at that curve that's going across the nation, when you look at the crisis of places like Houston, there's and then you turn it back to Massachusetts. Yes, it's great that our infection rate is one of the lowest in the nation, but there's no Massachusetts exceptionalism that's going to dig a moat around us for the next X number of months. We're not going to become New Zealand. And just because everybody up here is more liberal and wears their masks more often, so this thing is coming. And I feel like we have to responsibly and safely adhere to the consensus scientific opinion. And this document does not feel like it's in that spirit.
Mr. Harrington.
Yeah, I absolutely agree with everyone here. I'm not willing to budge a millimeter, a speck, a atom on the 6 foot. Our kids shouldn't be lab rats, and our buildings shouldn't be petri dishes, especially for somebody's political gain, so that they can gain favor within their own party for having made other decisions previously. But yeah, I don't think it's even worth considering the 3 foot minimum.
I'm just going to add to sort of the outrage also that I'm hearing is that it really doesn't pass the smell test in the sense that we've been waiting for a while for this guidance. So many other states have issued much more comprehensive guidance than what we just got today. And this is after, I think, 4 times that they've told us, DESE has told us that we're getting guidance and then kick the can down further and later. And yet they're not pulling in any new research or any new studies. The studies that they're citing are from March and February. And I think the latest was April. And as we know, anything, having tracked the news since this pandemic began, statements are made, and then a few weeks later, it's new learning. So early on, we said, it's only people with pre-existing conditions are getting dramatically ill. And then we find sort of the healthy young college athletes that are spending weeks, months in the ICU. And we hear, we've been told that young people don't get the disease. And yet now this week's headlines are that because students are going back to school in the South, and lo and behold, they do get sick, and they are getting the disease. So, it really doesn't pass muster in my mind. And so I wholeheartedly agree with fellow committee members and sticking with the 6 feet. Ms. Hall.
So, I mean, I'll just add to the chorus, same here on everything. And just, I also am not at all a public health expert, but it does seem like from the, non-scientific things I am reading, the places where there is success in reducing or eradicating are places that follow the advice of public health experts. And I don't want us getting our public health advice from a commissioner of education.
Ms. Spitzer.
Again, I'm going to join the chorus. I found it really surprising that they would advise 3 feet. And I think if anything in this situation, I mean, the really hard part is I know staying home and these schedules that are going to be required. Like, I don't want to ignore the burden that it's going to put on our families if we maintain the 6 feet distance, because it is going to mean like really difficult scheduling. And I'm a parent of 3 kids. It's going to be difficult, but I'd rather err on the side of caution in protecting the health of our community than to, put rather than to put, the economy or political pressure first. So it's not without cost, but I think the 6 foot guidance, I don't see any good reason to turn away from that.
Ms. Jean-Louis.
I agree that we should stick with 6 feet, and it's better to be safe than sorry. And I also find it the fact about the K through kindergarten and first graders not required to wear a mask. I understand it's harder to enforce that, but I feel like if anything, they need to have, because their boundaries are different. They need that mask more than anything. So that's something else I think we should consider.
Dr. Morris.
Well, thank you. That makes my life much easier because I was going to have to argue with you if you all went the other way. So that's if time in the agenda as well. A couple comments I'd like to make. One is to Mr. Jean-Louis' point. I don't think there's anything that precludes this district from requiring masks for students in kindergarten, first grade. That's a conversation we could certainly have. And I think to Ms. Spitzer's point, we're still working, but the 6 feet, there's more possible at 6 feet than probably we originally thought. Part of that's because our staff has done an incredible job, both teaching staff and maintenance staff, of doing dedensifying. We've looked and analyzed every space in each building that has windows. And so do I think we'll get 2,600 kids in the building at any time next year? No, not at 6 feet. But we might have, we're still working on it, but it might be more possible in certain schools to, I wouldn't say normal schedule, because I don't think we'll get quite there. But I think there may be more options at your disposal to think about than now that we've actually mapped it out. One of the big things, and I know it's silly, but this was in the original document, but is staggering the rows actually contributes to 6 feet instead of like what we first did, which was measure 6 feet and have rows one behind another, but staggering them actually is a much more effective way of where students would be located. But I really want to thank the staff. I don't know how many dumpsters of material quite literally like left our schools, but you walk around our schools now and it looks markedly different than a month ago. And so I want to really appreciate staff members for taking this so seriously and for doing a lot of work that will make more possible. Work has already started at Wildwood on the quads. I was over there Tuesday, I want to say, at Wildwood Elementary School. And it is really interesting to see both how you get cross ventilation now, which almost never happens in any classroom anywhere, and also how the venting is going to work and how different it is and how it's going to improve air quality. So I'm excited about some of the changes. I think some more things are possible than what we originally realized at 6 feet. And I fully endorse and agree with the school committee perspective I was going to have a really hard time ethically what I was going to say if you all were like, nah, 3 feet, just do it. But that might have been our first group fight, right? But I'm glad we didn't have to go there because I agree with everything that you said. And one thing we know is when you push the boundaries of COVID in terms of CDC guidance, bad things happen, right? Like we have evidence of that everywhere. And so I want to stay true to the original statements I made, which is kind of what I'm trying to develop and our team is. We believe that in-school education, one thing I agree with in the document, in-school education is hard to, it can't be beat, for the vast majority of students. And so using 6-foot guidance and some creative use of space, how do we get the greatest number of students in safely, right? And that's our challenge, and that's the puzzle piece that we're working on. And, I want to thank our team for some really creative uses of thinking about where could people be and what spaces do have multiple windows and good ventilation, and how can we think a little differently about space? We're not going to have full classrooms in spaces that don't have windows, right? Obviously, that's not going to be advisable, but it really has pushed us to think differently and more creatively than even where we were 2 weeks ago. And so, we'll come back and we'll talk about this later on in this this topic about what next steps are and what's the timeline of decision making. But I just want to emphasize I fully endorse 6 feet and having that model. B, my job, what I pledge to you is using CDC guidance to come up with options for your consideration that may be able to suit more students in school. And the C, this is the hard part, is we also have to know, and we'll get this a good segue if there's not other questions or comments, to not every student's going to return to in-school instruction. And we have to think about that as well. Even if we're able to get all students in some of our schools, we know not all students will choose to return, and we have to be really conscious and cognizant of that. But if people have other comments or questions, I don't want to transition without giving people time to respond.
Mr. Demling.
Yeah, I just wanted to say briefly, even in light of how strongly and unanimously we all expressed that opinion, I hope that these two core conclusions that this document is based on, these two core assumptions, that 3 feet is just is good enough and that kids are much less likely to transmit the disease and get sick, I hope they turn out to be true. That would make our lives and the lives of our students and staff a lot easier and be much better for human health and minimize suffering. Like, I hope that the established scientific consensus comes to that. And if the evidence mounts, then the professional organizations like the CDC will come to that conclusion as a good scientific organization could. It's just that they're not there yet. And that you can argue what an individual armchair epidemiologist like Commissioner Riley or myself might conclude, but you can't argue that the scientific consensus is there yet. And I think that's just where I'm at.
Dr. Morris?
Could I add just briefly to that? And I also think starting cautiously, and if things are going really well, opening things up, as opposed to jumping in with the evidence that we saw in this report, to me makes a lot of sense. And, I agree. I hope it's all, works out as swimmingly as Mr. Demling just stated. I fully agree with that. But I think starting with the 6-foot piece seems to me like that's a sensible, cautious approach. And I think when we get to the data, there's some feedback about that we collectively have built some goodwill in our community. And I think the data will show that we are cautious in our approach, that we, did forward and close schools before the state told us. All those types of things, I think really matter to people in our community. And I don't believe there's consensus on all of it. I wouldn't claim that at all. But I think for people who are really wondering and if they can trust sending their kids back, I think it actually sends a really strong message. I feel confident that if we went down to 3 feet, it would change some people's opinions about whether they would send their children back to school. So I know the effort is to get more kids in. I think the net result would not necessarily yield in the same way, the same results, because I do think we'd see, and again, this will come out in the survey. That wasn't a question, obviously, because the survey was done before this report came out. But I think for the people who are in the likely and particularly in the likely category, they're still waiting and seeing what our plan is, right? And that totally logically makes sense. And I think that really hits on Mr. Demling's point.
Ms. Spitzer.
So one of the things that struck me is that this is requiring us to create three plans. And I think it's great that I want to just first of all say thank you to everybody who's been working in the administrative and the working groups that have been formed to start that planning even before we were told we needed to start that planning. I think that's really excellent that we've been doing that all along. But I guess I wanted to get a little clarity. So one of the plans is everybody back in school. One's a hybrid model, and then one's a remote only option. And from what I'm hearing, is it true? Is it then that if we, this is the right thing to do, I think, stick with the 6 feet? Does it mean that essentially we're creating only two models because there won't be an option for everybody to be back in the building, or is that kind of a to be determined thing?
I think it depends what district we're talking about. I think there could be a conclusion where, right, there's 3 districts at the table here. It could be the situation where some districts are able to come back closer to full-time and some districts are more in a hybrid model. I don't see options, and we're still working. I don't see an option where in any of the districts where students are attending the same hours 5 days a week, right? Like, I don't see that. Are there options where maybe reduced hours 5 days a week is possible at 6 feet? I think we're getting closer to seeing whether that's possible in a couple of the districts, but certainly not all 3. And I don't want to be like too leading, but I think we're not at a conclusion stage to be able to say that definitively. I think I've been pretty clear from the beginning that I think thinking about the elementary differently than the secondary makes a whole lot of sense, and that's why a lot of countries did that. And so there may be some distinction based on the physical space and also the differences in staffing and electives and how complicated that gets at the secondary level versus elementary. So when we come back next time, I'll have more, but I would not say that in my head, I've not closed the door on some level of 5 days a week, but I think for me, I've closed the door on full-time 5 days a week in school at 6 feet. If that, I know it's a little vague, but I'm just not ready to commit to being definitive about it. So sorry, that's like a weird teaser for a future meeting.
Ms. Kenny.
So are we asking teachers to now translate their classes into 3 different models? So like you have your regular thing you've been teaching for the last however many years, and now we need to ask you to also figure out how to do it part in school and part out of school, and do it all out of school. That feels like a really mean ask. Like that feels yucky to me.
So this actually gets to one of the things I want to mention later, but I think I do want to respond to it now is, we're in this weird chicken or the egg thing where I'm trying not to ask anyone to do anything. Like that's my comment back to Mr. Demling before, except our administrative team, which sadly I'm asking them to do an awful lot. But there's some urgency to get to a decision so that people can plan for it. And yet there needs to be enough time to engage the community and continue to engage the community, including staff, on what that decision is. So at this point, it's a weird feeling because in some ways I'm like, if we just had a decision, we could do a lot, but at the same time, that's foolhardy planning, right? To rush a decision. So when we get to that conversation on next steps and engagement, I think we're gonna have to right size our approach. This is not a typical process. Like if this was a typical problem, if this was a problem in a typical year, this kind of scope, we would take 8 months to study it. We would have lots of experts come in. We'd maybe have a consultant. We'd get a 60-page report with annotations. That's not the world we're living in. I do believe we probably need to get to some level of consensus in the next 2 or 3 weeks to move on it because of all the reasons you said. I think it's not fair to teachers. We're going to have to figure out how to staff this. People are going to have to think about what those models look like and who's doing what, and people might be in different roles and frankly in different rooms. And so there's an awful lot to make decisions. And the way I would describe it is there's tiers of decision, right? The first tier of a decision is like sort of like who's in school, what hours, what days. And then there goes to a second decision. Like at the secondary level, we're not running, I'll just say another like rule out. We're not running a 7-drop-1 schedule. We're not having, which is our schedule at the secondary level, which means students take 7 courses, they drop 1 drops each day and it rotates. We're not having students change and be in 6 different classrooms and cohorts a day. It's not going to happen. So, right, then the next tier of decisions, what's the schedule? We are actively working on that. What's the transportation, right? So there's so many decisions in the queue that I think we actually need the first one relatively soon so it can trigger all the other ones. And then you're talking which is a decision that gets to like probably 3 stages beyond the big one that you make, is what exactly am I doing and how am I planning for that? And so I'm glad you raised that point, because I do think it's going to be decision after decision after decision. We can't wait till it's one package, because there's so many contingencies that are built in. And that's why we did our family survey early before the state had it. That's why we got information from staff about people who have medical vulnerabilities and are following up so quickly. We need to do all that, because to map all this out, that's critical. Like who's going to actually be in the building drives what our instructional model looks like. Sorry, long-winded answer again. I'm really bad at that tonight.
It's hard to be concise in this this topic.
Yeah, I was bad all day, not just now. I was really bad at 2 o'clock. Obed got to see that, so.
I think one thing that strikes me is that your description, Dr. Morris, earlier about the 4 competing, I don't know if you said constraints or factors or what, but it really is, you pull on one a little bit, the staffing, transportation, facilities, maintenance, cleaning, and space, and you pull the thread on one of those, and it sort of makes additional constraints or freedoms on some of the others. And so it's really, really, it's actually really unfortunate to have only partial guidance at this point from the state, because we can talk about those 3 plans, and yet there's still so much that we don't have guidance on. And so again, it's incomplete. And I sort of echo Ms. Kenny's concern that if we have to be submitting 3 separate plans, and we don't even know to what level of detail we need to get to each of those plans, and we still don't even know the transportation requirements, it seems like it's a lot to ask in just a matter of weeks. And August, does that mean August 15th, August 31st, right? So, it's huge. So I think, to whatever extent that we can start to sort of narrow the funnel and help that, so that some of the other answers, options or variables might be taken off of the table because we started to narrow that decision. I think it will help us, I think, wrap our minds around it, but certainly I would imagine that would help you and the rest of the district staff in planning.
Yeah. Thank you. I appreciate that. This will be a summer unlike we've had. So that's for sure. And I think the sooner we can get a direction, and that's really what I think many administrators and teachers are looking for, is if we get a direction, not everyone's going to agree, right? That is guaranteed. But some direction of a way we're going. I think there's a strong consensus, and I think this came out in some of the public comment from staff today, that, we thought we were going with CDC guidance, right? We felt comfortable with that, and now there's something else. So I think it will be comforting to many staff, and I think many in the community in terms of parents, guardians, and caretakers, that we're staying with the original guidance we got and not transitioning to new guidance that maybe there's less public confidence in at this point.
Any other thoughts, questions, comments? Mr. Demling?
I guess I'll just say briefly, another elephant in this room is, what exactly is DESE's and or the state's posture going to be to districts that push back as hard as we just pushed back? What is guidance and what is requirement? And when the rubber hits the road, what actually are the levers of power and pressure that people are willing to pull? So I guess I would just say, Dr. Morris, as you have these conversations with perhaps like-minded superintendents in the coming days and weeks, to be in close touch with the school committee, because if there becomes a need for public affirmation of what the committee just discussed, and if we need to do that in a way that we are joining in a chorus of voices with other school committees or superintendents, I'm guessing based on the intensity of the response tonight, that's going to be something that we're into. So, and in these uncharted waters, it might be something we have to do. So, if you could just keep us updated on that, that would be good.
Yeah, we'll do. And I think there may be other school committees that actually are worth watching the video tonight, frankly, because I think, there may be some apprehension about coming out as strongly as it seems like people didn't struggle here. People may struggle in other places, right? The whole H and Amherst thing probably at work. I think the same is true in Pelham, Leverett, and Shutesbury, just for my colleagues there. Do we want to transition to survey results?
Yes.
Sure. So to clarify, because we've done a number of surveys lately, we've done a distance learning survey for middle school, high school students, families, and staff. We did a staff survey that is not public information because it first of all, it's legally not public information, it's HIPAA, but we have some information from staff that we're following up on. Interestingly, the idea of childcare for staff was one that was pretty popular, so that's something we're going to have to come back to depending what our model is. That is, I feel comfortable sharing. But what Obed and I are going to present is a slide deck that summarizes the parent feedback. So we're really looking, because we captured individual parent feedback because it mattered to know, if, we disaggregated, you'll see some of the race ethnicity disaggregations, but we also were able to disaggregate by grade level, by school, and really for planning purposes. You'll see in the data that we got about the respondents represented about half the students in the district, which, could always be better, but based on a survey, we don't usually get half. So we were pleased about that. And there definitely were some trends worth talking about in terms of what families told us. And so I'll queue this up. I'm going to do most of the quantitative data, and Obed did a lot of the qualitative research based on this. So I'm going to turn it over for Obed to do that. Just as a reminder, I won't be able to see you when I bring up the slides. So if at any point people want to interrupt me, please do that, but I won't be able to see hands up or anything like that. So let me get this going. There we go. Okay. Can everyone see that just because I can't see you?
Yes.
Okay, very good. So again, I worked on this with Obed. Obed deserves most of the credit for doing this, and he jumped right in with both feet. So thank you for that. So we're starting with actually a survey that we didn't do. Suffolk University came out. You could see it was on Mass Live. It also was a big article in the Boston Globe yesterday about this. So they surveyed 500 Massachusetts residents. Just about half felt hesitant to send students back. About a third felt comfortable, and 16% undecided. This is not the same survey question we asked, but I thought it was a helpful data source. And there is some level you can, assume some proxy compared to our data. And will K-12 schools open away, keep all children and adults safe? You can see it was pretty evenly split. The Boston Globe really focused on the second part about the demographic differences of responses. 56% of white families answered yes, that the schools will open a way to keep children and adults safe. Only 40% of Black and Latinx families answered yes. A lot of the theorizing about this difference, the 16% difference, was focused on two factors. One was that in Massachusetts, Black and Latinx families are 3 times more likely to be affected by that based on the data that we have. And also just having to trust the government, was a factor. That's what people theorized. They didn't have enough data to really drill down into that. But we thought it was important to include. Another question, was about comparing the possible spread of coronavirus versus the effect of school closure. You could see that, it was pretty even split across the state about the need to return to school versus remote learning, and the data from Suffolk. Today, I saw the Mass Inc. did a poll, larger sample size, 1,500. You can again see actually even a greater difference based on race ethnicity about confidence level about preventing the spread of coronavirus. And I think the data speaks for itself there, but you could see a substantially statistically significant difference there. So now we'll get to our survey. So in general, just a reminder, surveys were collected to gather a sense of families' plans for fall. An important caveat is, especially given our prior conversation, the survey indicated that the CDC guidance would be followed. We don't know what the impact would be if we follow the DESE guidance versus the CDC guidance. But I think as you'll see later in some of Obed's comments, I think we can come up with some reasonable conclusions about that. We had 879 responses. That's 879 parents or parents' guardians. So it represented over 1,000, well over 1,000 students. And the following questions are the ones we're focused on. How likely do you have your children return to the district in the fall to in-school instruction? And will you need transportation? So on this first one, the quantitative data, you could see that about 47% responded definitely, 39% likely, about 11% unlikely, and about 2% definitely not. So that, it's not exactly the same question as the other surveys, but I did react positively to that data, that the majority, vast majority of families responded definitely or likely for returning to school in the fall. That may be because our area has lower rates of transmission at the current, or lower rates of positive tests at the current moment. It may be because of some of the cautious steps that we've taken throughout. But I was surprised, frankly, at those numbers. And we did not ask for race ethnicity on the survey, but after the other two surveys, we went back, and because we had the respondents' names, we were able to use Parish School and cross-reference how the responses were. And you could see the same trends in general were true, that white families, so the blue, just to be clear, the blue is definitely, the pink is likely, the green is unlikely, and the purple is definitely not. So we looked at how students were coded in Power School, and based on their parents at the time of the registration, how the parents filled out the boxes. And we see that trend. It's less significant, the difference between race ethnicity groups, but there is definitely a difference in the responses that we received. And the N size is enough where I think we can come up with some conclusions that these differences are real. And I think it's really important to note because, as I said earlier, we know two things. One, we have to continue to do outreach about what our plan is once it's developed and try to build confidence in it. And two, there's no right or wrong answer to this, right? Some of the reasons that people may not be comfortable sending their child back is they may have been directly affected by COVID. Family member may have been directly affected by COVID. They may have a child or someone in their family who has autoimmune challenges. So there's not a right answer. I want to be really clear that there's no judgment based on those answers. But I think it is notable to look at the differences. Well, less than in the Mass Inc. poll for sure. There are differences in the responses in our district based on race ethnicity. I'm going to turn it over to Obed now. And Obed, whenever you want me to advance a slide, you just tell me that. But he's going to describe looking through hundreds and hundreds of responses and what he saw as themes to the qualitative data.
All right. Thank you, Superintendent Morris. I'm just going to pick up where he left off. I just wanted to draw your attention to what Superintendent Morris said earlier about how, in comparison, at least to the state level data, parents in the district seem to have a more positive feeling towards returning. And our goal with the qualitative data is just to unpack that a little bit. And so if you recall, the first question was just trying to assess how likely is it that parents would return children back in the fall. And for those who responded definitely, one of the themes that emerged was this desire for direct in-person learning. And this was for a variety of reasons. For example, for parents with children who have special needs, online education was a disaster. And so having a school in person would be much more feasible and be able to cater to their children's needs. Or it could be in the instance where parents have to start getting ready to go back to work. And so with that, they may not be able to provide the educational support that in-person learning would provide. And also and this goes without saying, many parents express that in-person learning is much better suited to suit the socio-emotional, mental health, and academic needs of students, whereas online learning doesn't, or at least it doesn't do it to the same effect as in-person. Something else that came up was a trust that if schools were to reopen, that the district would implement and enforce the necessary precautions to keep students and staff safe. And so that was a positive remark that many parents expressed. And in addition to that, ultimately, many parents expressed that they understand that there are no guarantees with any measure. And the ultimate decision about whether they decide to return their children would be based on CDC and state guidelines and how the district implements those rules. So yeah, for the next one, for those who responded likely, you see a lot of those similar themes about having a desire to return students, but also understanding that that decision is based on the health guidelines and how schools implement safety protocols. Many parents in this group as well, they expressed that they were concerned that their students, their children were going to be losing education if a sustained online education model were to continue. But they also understand that the current pandemic is a dynamic issue and it changes day after day. And so it's hard to be sure about what's going to happen. And another aspect of this, of their opinions were that even with the safety protocols, there was a desire to ensure that they not only address students' physical needs, but also their psychological needs. So we can imagine how social interactions are going to change and like how student life may change as a result of safety protocols. Many parents in this group were saying, yes, we understand that there needs to be smaller class sizes and like frequent hand washing and a lot of different safety protocols, but how are these safety protocols going to address students' stress and anxiety by coming back to school? And in addition to that, many parents were just curious about needing more information about the particular model that will be implemented in the fall, whether that's going to be more of an in-person model or a hybrid or strictly remote. So if we go to the next category, these are for parents that said it's unlikely that they return students. And this was a common theme was that there was already a preference for online education. Parents in this group were expressing how some of their children had become accustomed to online learning and they don't see a need to go back to in-school. And so they just wanted to maintain that. And also there was a concern for, let's say some parents expressed that there is somebody in the household, whether it's their child or themselves or somebody else who has an underlying health condition. And so there was a concern that by sending kids back to school, that would be introducing additional risks. But even with that, a lot of the responses show like a tension between wanting to fulfill their child's socio, emotional, mental health, and academic needs with their physical health, and ultimately understanding that that's a tension that is going to be hard to navigate. And a last theme was just that in this group, they were a little bit more critical of safety precautions and how well it could prevent the spread of the virus. So for example, parents are saying it may be too early to send students back to school without like a vaccine, for example, or as flu season emerges, there may be a resurgence in cases. So there was a critical view towards whether or not the safety precautions could prevent the spread of the virus at schools. And if we go to the last group of parents that just said definitely not, it goes along with just that there's too many unknowns at this particular moment as far as what the course of the virus will be when it's time for schools to reopen, and things like that. So there was a lot more pushback in this group. Same theme as before, just there's not enough confidence that the safety protocols would keep all students and all staff safe, and also the issue with having somebody in the household who has an underlying health condition.
So we still have the transportation question to talk about, but Ms. McDonald, do you want to pause for questions about this data set before we talk about transportation?
Yeah,
keep...
yeah, that's a good idea.
Okay, sure.
Any questions from the committees? I'm seeing none. So, so I suppose we can continue on.
Right. So we asked this question about transportation because we know that, there's not going to be, I don't imagine a scenario where there's 57 kids on a bus. And sometimes in our elementary schools, we have 57 kids on buses. So one of the things we're trying to ascertain was, will families be able to provide transportation from the district? So you could see about 36% said they would definitely be able to provide it. About 27 said likely, and then the rest said about 34 said that they would either likely need transportation or definitely need it. There was actually a difference that was surprising to me. The elementary numbers, which I assumed to be higher for the people's ability to provide transportation, were actually lower. Some of that may be because high school students drive, right? Some high school students drive. I shouldn't say high school students in general. There's 14-year-olds in high school. We hope they're not driving, but but the elementary numbers in Amherst and Pelham were in the low 30s, and at the secondary level, that number was in the high 30s. So it averaged out to be 35, but that was actually a surprising distinction in our data set when we disaggregated. So I'll turn it back to Oved for the qualitative data.
Okay, thank you. Same thing with this one. We're just going to unpack some of what the parents said. So for parents who said that they would definitely need transportation from the district, a common theme was just that because of parent schedule, it's just not feasible for them to bring their children to school. So they'll need transportation, or in the case of families where there's a child in the family that has special needs, there's going to be a need for transportation. In the next group, for parents who responded that they'll likely need transportation, a common theme was that there was a sense of like flexibility. Say for instance, a child was already accustomed, had been taking the bus already. Parents are, at least in this group, they were okay with allowing the child to take the bus, but if there's limited like spacing, or the bus is not an option that's available to all parents, parents did express that they can adjust and provide transportation if need be. And this is kind of a persistent theme in this group and in the following groups, but there's just an overall concern about the safety of the buses in general, and how effective will social distancing and other safety protocols be on the bus, and will children be protected on the bus? So if we go to the next group, that was a theme for parents who were likely to provide their own transportation. Just again, will the buses be safe during the reopening? And again, there's parents in this group also expressed this flexibility between being able to provide their own transportation and using the school bus, which is basically, if school busing is available, then they're okay to use it, but if not, or if it's extremely limited, then they have no problem with adjusting and using their own transportation. And then for the last group, pretty straightforward. For parents in this group who will definitely provide their own transportation, this is because a method of transportation has already been established. So whether it's their child has already been to school before COVID-19, or biking to school, they'll just continue that, or being driven to school, they just continue that way. And as with the previous two groups, there's just an overall concern about how safe are the buses, and how protective the safety will be.
Yeah, and I'll add just briefly at the last group, we also had a number of school choice families who said, this is what we normally do, so we're going to stick with it. And so there are some families who do this actually not by choice. They choose to be school choice families, but there's not buses or transportation provided for them to begin with. And there was some comments along that domain as well. And back. So again, that was a summary of the data, because there are some personally identifying pieces of information in the data, not just names, but other than that, we chose to offer themes instead of the full data set, because we would spend hours and hours and hours scrubbing very personal information. I want to thank the community for being so candid with us. I'm sure Obed saw that in his data, in his viewing as well, that people were able to share really the context. And I think that's the downside of not being able to share the full set, is that you hear these personal stories, but we committed to not sharing those publicly, and they are somewhat identifiable. But really want to again thank Obed for doing that deep dive and coming up with themes. And start with where end with where I started, that I'm encouraged about the data that we have about students' willingness, or families' willingness to have their students either likely or definitely come back in our buildings. And I think the earlier decision that you all came to, I think is the commitment that people are looking for. Like, if they're going to send their most precious things in their world to our buildings, that we're following the strictest safety protocols to make that happen. So I think there's really a relationship between these two conversations, the earlier one and this one. But at this point, we'll pause and see if anyone has any comments or questions for us.
Mr. Demling?
Yeah, I just want to thank Obed and Superintendent. This is a really good level of detail on this particular topic. There's so many different, tents to cover here, and this transportation one is such a sticky wicket in so many of these models. And I'm glad you brought it up after we talked about the DESE guidance, because this is another aspect of the everybody back at school all the time, where it could create a massive equity issue, where, you know, if it's because it's a lot harder, obviously, to enforce desired distancing, maximum health in a bus than it is in your own car.
Yeah.
And so if you don't have access to your own car, or you need to get to work earlier or later, you know, we don't want a scenario where if you have less economic means, you are going to, by definition, be less safe. And I can't remember because the guidance has only been out, but I don't really think they covered much transportation detail. And that's probably why they are glossing over the implementation detail of something that would be incredibly hard to do equitably. So thank you, Obed and Dr. Morse, for bringing this situation up.
Thanks.
Any other questions or comments? Ms. Spitzer?
I'm curious about thinking through when or the next steps for the transportation. So all of this was non-binding, and I think that's totally appropriate for now, but just I keep talking to parents, they're like, when am I going to get a sense of what the schedule is going to be and of the transportation? So especially for the transportation, are we going to ask people to kind of at some point make a binding decision that you're agreeing to send your kid, drive your kid to school every day? Or are we going to, and this is something to just, I'm just raising this issue, not that it needs to be declared now, but I think it's important just thinking through, you know, will we let people have flexibility, or does our planning require that people are going to have to commit for, you know, is it going to be in 3-month intervals or 6-month intervals, or for the entire year that you're going to commit to driving your kid? Would we allow for occasion, like, for example, I'm learning all about the preschool guidance because my daughter might be going back soon, and they have a guidance where you're supposed to have the same adult every day be the person dropping off. So are we going to have these requirements around transportation where it has to be a consistent person? Would we let for occasional carpool? And they're just, I think it's just the tip of the iceberg, you know, saying like, how likely are you going to be able to do this? And so I'm just curious about when we'll be able to get some additional guidance from DESE. Not that, given the guidance we got today, I'm not very optimistic that it'll help us at all, but just in terms of the timeline.
Yeah, so here's a couple things. One is, I think when we develop models, we will have to ask some quasi-binding questions around it. I do like the idea of carpooling for families from a public safety perspective. Having over 100 cars come to our school to drop off kids, not the best, right? And so, you know, we think about, I know other states that are a little ahead of us have really tried to link up, if they're able to do placement, can families with kids in the same class be encouraged to carpool, right? So that you're you know, it's not necessarily you're exposing kids who aren't going to be together all day in the same car. So I do think we're going to have to get to that place. I have seen some states, although I don't think it'll fly in Massachusetts, actually ask families to commit to attending school for the semester. Like, either you're going to be in school or you're not going to be in school. And the next time that families can choose to be in school is at the end of the semester, because one of the things, and it hits not on transportation, but also on the class size. So if we start the year and let's say a room can hold 18 students and be 6 feet apart, and we have 18 students or 17 students and 2 students, it's going really well. And students say, oh, I want to come back in October. We don't really have space in that room for them. So there's all sorts of questions about binding decisions that we'd ask families to make that is going to be really delicate. And I think when we come back next time, we should have a really explicit conversation about what's reasonable to ask of the community. I think we may have to ask things that we don't typically ask families to make in terms of sort of binding decisions around not just the bus, but actually attending in-person school. And that may not be, you know, asking people to do that 2 weeks from now, but certainly would need to know that well before we come back. So I think that the transportation is the tip of the iceberg in terms of the types of questions we need to get information from families. This gave us a really good sense. We have to plan for the vast majority of kids coming back, right? So in communities where only 60% respond positively, and other people are doing similar surveys, these numbers are the highest I've seen. Maybe there's other places that are higher, but I haven't seen them. They're able to adjust down a little bit their expectations for class size. What we learned in the survey is we really can't do that. If we have something like 90% or just a shade below saying likely or definitely, we have to assume that all of those people are going to come, right? And so that is, from a planning perspective, that's been among the most helpful things is, any kind of hopes from a logistical perspective that the number would be lower are now dashed. And in our planning, we're planning for everyone coming back, knowing that we'll have some yield and not everyone will come back. But 90 is pretty close to 100, and we want to have some wiggle in terms of like if 10% of kids don't come back, but we get new kids in the school, then we want to have some wiggle room and not be kind of reshuffling once we get things rolling. So that's one of the key takeaways from a planning perspective. But I think you're right on the transportation end. That'll hold up the whole thing. We can't figure out financially or otherwise logistically how we would stagger, right? Some places are mentioning like, oh, you stagger the buses. There's not that many buses and there's not that many drivers. So every run costs X amount. And so, we could look at that, but we're not feeling wildly optimistic about that. And, Northampton has made a commitment that they're only transporting kids who live 2 miles or closer to the school. That's a different decision. I'm not critiquing that decision. I'm just saying lots of places are trying to think about how to make this work, and they're not providing any transportation, I believe, at the secondary level. As a regional district, that's not an option. Even if people wanted to pursue it, it's not an option people have here. But I do think we're going to have some hard conversations about that. When we talk about models, people may love the model and not love some aspects like that of it. And all these models force us on space. So they might love the model and not love the room that their child's going to be in because it's not usually a classroom. So all these, I think to Ms. McDonald's point, they're all interrelated, forced choices that impact each other. And that's what makes this so complex. I made it worse, not better, Ms. Spitzer. I'm sorry.
Ms. Hall?
Related to that, is it possible I don't know if in future surveys to introduce some element of like assessing hardship? I mean, It strikes me that there's a big difference between someone who simply cannot drive a child to school as for someone who's like, well, that's annoying, I don't feel like it. And maybe having there be a little bit of that might be a way to get a few more kids off of a bus. And I'm sure there are other questions where for some people it's like, it's annoying to try to teach my kids math, as opposed to other people who are like, no, I can't. I work in an emergency room, I'm not there. And I feel like assessing whether or not someone truly can, or it's just annoying for them, I think is an important distinction.
Yeah, it's a hard one to parse out at a mass level, but I think you're right. And the only thing one of the things that concerns me about the finite 2 mile thing is that that's not looking at the need, right? That's looking at a physical distance and what the state law allows us to do. And that may be okay, but it may be that we have a high density of families who are higher need in terms of transportation, are more reliant on bus, who live closer than that, but far enough where you can't have elementary kids walk. Our schools, with the exception of Wildwood and some aspects of Crocker Farm, are not particularly wonderful for walkers. They're on really main roads. Like there's not many kids, except for one street from Pelham School, for instance. That's a really busy road that people drive really fast, and it's on a big hill and you can't see, right? Like very bluntly, like we don't want to encourage elementary kids walking down Amherst Road in Pelham. Like it's not what we want to do. So I think you sort of have to assess both, and that's where there's a lot of complexity. And I know I keep on, teacher gave me this feedback actually in a positive way the other day, but like I continue to share complexity, but I'd rather do that than pretend I have all the answers or this is easy, because it's not. So know that it's only out of transparency and candor that I make things complicated, not because I'm trying to make your all life difficult.
Yeah, I mean, you did not make this complicated. I think the global pandemic made it complicated, so.
Thank you for that. But I think it's good for all of us to be transparent about, I thought it was really good feedback. It was like, this stuff is hard. None of these choices are great, right? Some you're all gonna land on the one that you all think is the best choice for our community. There's definitely not going to be wide consensus. I don't envision that being the reality, because everyone's context is really different. And I think actually some of the data and the differential data, even in the survey that Obed and I presented, shows that people's perceptions and reality are really different, even if lots of other things are the same. The Mass Inc. one, I didn't go into the level of detail because they also disaggregated by race, gender, and socioeconomics all combined. Really, really fascinating data set. It wasn't as relevant for our point of view, but if anyone's interested, I could certainly send that along, because you see differences along all three dimensions. The gender one is particularly interesting when combined with the others.
Any other questions or comments, adds? No. Seeing none. Okay. Well, thank you, Obed, for your detailed analysis. It was really insightful and helpful. So thank you for that, for helping us out. Okay, so the next item is our process and timeline for decisions on the model. And I think we'd had an initial sort of proposal for a timeline that went out the window when DESE threw it out and said that we weren't going to get guidance until today. So I think this is more of an open-ended conversation, I think, in terms of thinking through what's next. And I will go back to, I think what might be helpful as a starting point, Dr. Morris, is to maybe outline what order we should be thinking about the decisions that we need to be making to help support the planning that needs to happen in this short time frame. So I know when we first talked about it, we were talking about landing on the model, but there's so many more decisions and micro decisions in there. I think sort of, I know it's complex, it's not clear, but if there's a way that we can sort of just map out without putting a timeline, dates on them right now, just sort of talk through like roughly what order are the decisions that you need us as three committees to be making.
Yeah, so I think the first one has to go with the space one. So what I think I could come back relatively soon with is what we surmised at 6 foot space. So that's great because we've been already working on that. What's possible, right? Because I think I've been clear, as I said earlier, throughout, that my goal is, given 6 foot social distancing and guidance, what's the greatest number of students we can safely get in school, right? Because I think, again, what DESE said is true, and I think what we hear from families is true. Heard from families that in-person education is substantially better than virtual, and there's a ton of data that I presented in early June that supports that point. And so I think that's something that in relatively short order we could share, because we've already got all the space. We have one elementary school that's giving us some fits, but I think other than that, you know, I feel pretty confident we have a good sense of what options are in all three districts. I think, you know, that's also not including transportation. So it assumes that we'll be able to solve the transportation challenge. And I think that's a hard one, but I don't see how else. I don't want to wait till mid-July to talk again, right? I don't think that's reasonable for the committee or the community. So I think that's where it goes and fits and starts. But I think from a space perspective, I can share what spaces we would think to use, what spaces we would not use, like ones without windows, things like that. And frankly, if we want to get kids in as much as possible, it might mean maybe less than we were originally thinking, might mean that at least some students or programs need to be in different spaces. I do think the point about special ed and some special ed and some ELL students attending more often is something we need to add to the mix. We talked about that when I first presented some options. We'll need to fine tune that. It makes sense for students in specialized programs because they have a sub-separate classroom. For other students with special needs, it's hard to figure out exactly what that looks like if it's on a hybrid model where one set of students is in 1 week and one set of students is in the next week. Having them sit in classrooms to learn the same thing 2 weeks in a row, right? That doesn't make a tremendous amount of sense. So we have a lot of work to do, and unfortunately, the DESE document, compared to like states like Wisconsin, which really got into great detail for students with special needs, wasn't as detailed, and so that is a little bit of a challenge for us. But I think that's the piece I could talk about. The facilities maintenance, I feel really good about. We still have work to do, there's no doubt, but I feel like, you know, between Ms. Consolino, Ms. Fetterman at the town, Mr. Roy Clark, and all their departments, we're making good steps to develop cleaning protocols and pieces like that. Transportation is hard to work on. Staffing we're working on behind the scenes because we've already surveyed staff about, you know, again, their any physical condition. So I think we'll have a good sense of that. So the space, I think, is the next one to come back to get feedback and analysis, because you all, I can imagine presenting that and you all saying, well, yes, 6 feet works, but XYZ, what about these other things? I can imagine you thinking about other spaces we should be thinking about in schools, right? I mean, I think that's probably a rich conversation. And some of the other ones, perhaps, not that they've gone away, but I think they may not be the next in the queue. That's just my sense, because I think the space will drive a lot of the other decisions that we make. But I'm open to other feedback or other thoughts.
Yeah. Ms. Dancer.
I have a question, which is, well, I'll just say what it is. How much time do you think teachers are going to need to prepare materials?
So that really gets at, let's say a couple of things. One is everyone needs a break, right? Not everyone's going to get one, but everyone needs a break. And so what I want teachers to do right now is certainly weigh in on whatever we propose, but mostly to actually not work, because everyone needs a break after this school year. What I'm focused on is how do we get more work days for teachers before students return in the fall, and how do we build in regular opportunities for ongoing professional development during the school day for teachers. So the first one might look at school calendar. I might come back to you and ask you to revote the calendars. I've already have a couple like mocked up of how we might change time. I mean, in terms of like when teachers return and when students return, and hopefully the DESE commissioner will relax 180 days, and that'll really help us out. But a lot of us have advocated for it, and we'll have to see. I think on the larger piece, I do feel like both from a staffing perspective as well as from a professional development perspective, having all staff have the same preparatory time is going to be really critical. And I'm leading myself a little bit, but I feel pretty comfortable coming out with this, that I do think if we started the school day later, regardless of the model, it would allow for a couple positive things. One, right, no surprise, lots of people are really interested in late start time, particularly at the secondary level, right? Mr. Demling is his mind's going. I can see it right now. But he's not alone. But I think more importantly for me is that this is not something you get trained in once and you're just good to go, right? People need ongoing work from an anti-racist perspective. People are going to need to teach differently. No one, I mean, I've been in these classrooms. I have images from upstairs here as well as Crocker Farm and Wildwood. No one is taught with students spaced 6 feet apart. That's not how we normally teach. And so teachers are going to need ongoing work on that. And for our teachers who are doing virtual, whether because it's a hybrid model or it's because they're working with students who are not able to come to school, they also need ongoing professional development and coordination. And I think one of the challenges that we always have in schools is how do we actually coordinate that when everyone has different preparatory periods over the course of the day. I also want to be blunt that we're going to run into staffing challenges no matter what model we have. Because the nature is if we're telling people, our data from early March showed when we tell people don't come in if you start feeling sick, people listen to us, right? That's a good thing. And so it's going to be harder to find substitute teachers. And we're going to need to coordinate a lot of that in the morning. So I think there's good reason to think about how do we have all staff have time in the mornings before students arrive much more than they normally do. And maybe that time for students can be virtual so that they are getting instruction. There are certain topics and subjects where I believe the state will not allow us to do them in school because of the health risks. And so we are trying to think creatively of, even in models where students are in buildings, could sometime first thing in the day, could students receive some virtual instruction, whereas the teachers who are in the buildings are getting ongoing professional development. I think your point's a really important one. I'm so glad you brought it up because it's something I feel really passionate about in any model, whether it's 5 days a week or every other week. Whatever we decide is really building in time for staff development that occurs when students aren't in the building. And finally, I'll just say, this is like my high horse because I feel really strongly on this, so I apologize. But if teachers all have preps at the same time, just our ability to cover the building is so much greater than it would be otherwise. So I do thinking there's two elements, right? What days do people come in, but also what time does the start time for staff and what time's the start time for students? I think all of that needs to be in the equation because assuming that teachers will just find time to do a different model, there's no evidence that that's a good idea.
Ms. Spitzer?
Sorry for the delay. I 100% agree that this is going to be a huge burden on teachers in trying to find, I guess, one thing I wanted to clarify, when you're talking about revising the calendar and getting around the 180-day thing, I'm assuming that you want to have fewer than 180 days for the kids to be in school. Is that the, so so school committee hat on, I 100% think we need to support our teachers and give them as much support in transitioning to this new model as possible. Putting my parent hat on, I'm getting palpitations thinking about, okay, they're going to be in classes for fewer than 180 days. They're going to be in for fewer hours, but I don't yet know what time they're going to start. I don't yet know what those days are where they're not going to be home. And, you know, especially, you know, my partner, we plan 6 months in advance, which days he's going to take off.
Right.
And so I know I'm not the only person who does this, but to the extent that we can, I think we should start making these decisions and communicating those changes in the schedule as soon as possible. And I know it's everybody's going to have to be patient and everything, but it's especially, I think, for the families with two working parents. I mean, this is, or one working parent, you know, only one parent in the family, or all different types of family situations. Having this information as soon as possible is really going to be key. And I think just starting to communicate that we're thinking about a later time, I'm just sure it's going to cause other people anxiety. And to the extent that we can kind of communicate early and often about what it's going to look like, I think that would be beneficial.
Yeah, I fully agree with you. And that's why I went a little more further than I planned to tonight, but I think it's a critical point for planning. And I think for me, it's not just, I want to be really clear. And you said this, Carrie, I just want to double down on it, is that it's not just around professional development, around some of the things I mentioned. What I didn't say is it's also around professional development around safety, right? So for me, it's about how do we safely open schools? And if we don't have time for ongoing professional development about how that's working, learning from what we're experiencing and making course adjustments, that really concerns me from a safety perspective. And so I just want to add that point because I wasn't explicit enough earlier that for people who might perceive this to be sort of fluffy kind of things, to me, it's part and parcel around safety as well. You know, especially if we're going to try to get students in as much as possible, we have to build in time for this to happen. You know, the other model is students are in less and we have more full days of professional development. And but those, I think, are the options that I feel like are ethically responsible to propose.
Mr. Demling.
Yeah, so building on Ms. Spitzer's point, I do feel like the core question that we need to answer sooner than we're ready to answer it is which grades are on site and when.
Mm-hmm.
To me, that is like the central nucleus around which all parents can start planning. And so when I look at the calendar, I mean, I know we probably can't pick a date tonight, but when I look at the calendar, I can't imagine not having that communicated by August, for example. Okay, and then so I'm just coming out from both ends. I also can't imagine making that decision in the next 5 days. So the question is then when in July, right? And so it really becomes a question, kind of like throwing it back to you, Dr. Morrison, and your leadership team, which is, what's the latest possible that we can make that, and then still have time to responsibly implement and communicate it. We know it's not going to be, we know any date in July is not going to be enough time that we want to be able to make these decisions. But, you know, I really do think we sort of have to force ourselves to sweat it out a little bit and mark a line in the sand and say July 20X or teen X, whatever that date is, and say that's when we're, you know, unless Tessie comes around and throws out another completely different document, you know, that's when we're going to do it. And then from there, people can understand, okay, that's the plan. Because I think we could have excellent discussions continuing through July and still not be at a definitive point, and just the clock's going to run out on us.
Yeah, and if I could respond, first of all, sorry for being in jest about late start, but I know how hard you've tried to get that on agendas, Mr. Demling. So it's late and it's a long call. So I agree. I mean, I think in short order, when I was talking about space, I'm really talking about, and I should have been more explicit, who goes to school when and which spaces. That's when I say space, we're doing all this work to map this out because we can say what's possible. And then you all have to help us with what you believe is advisable. But I think what I'd be able to come back with in short order, relatively short order, at a rough level is this is what we think we can do at the high school. This is what we think we could do at the middle school. And this is what we think we could do at the 4 elementary schools. You know, we could go there and then, you know, dig in. And again, I have more staffing information than I'll be able to share. But right now I know that we have staff who can't return, and that goes into this whole mix as well. And so I think that's as a starting point. And I think to Ms. Dancer, Ms. Spitzer's point, I can also include, you know, what I would think is sufficient, you know, start times, but it's not, I'm not looking for a decision that quick. It's just, I want to describe what I think is possible in terms of contractual, every teacher making sure that they have the preparatory period that they need, right, and that we're following the contract, but also what I think people need from a health and safety point of view. And literally where locations of where students would be and what the maximum class size would be. I mean, we're pretty close to nailing that down at the elementary level. Secondary level, we can get there. It's a little bit of a different cup of tea at the secondary level because actually changing the schedule is the bigger piece than just the space. Like literally the schedule that the classes are on. I told you earlier that we can't keep with the same middle school, high school schedule we have. Both of them have to change to reduce the number of cohorts. And that has many, many ripple effects. But I think we could get to some core general models in short order. And then the process, you have to weigh in. We could think about doing some online town halls, different things like that with both staff and the community. So we get some feedback so that we can kind of expedite some decision making while still have opportunities for feedback from the community.
Understood. Mr. Menino.
Hate to be pushy, but short order, is that next meeting, the meeting after next?
Yeah, I don't know what next meeting is, but yes. That sounds good to me. I think that's the logical next step. I don't know what else we would discuss if we weren't talking about that. That's sort of the meat and the bone. And I think, you know, given the feedback I got tonight, I think we're there. And, you know, we also have to have conversations about like multi-age classes and people's comfort level with that, right? There's a lot of variables, but I think, you know, at 3 of the 4 elementary schools, we have a pretty clear picture of what's possible. I think we're getting there at the 4th. We'll have some hard decisions for you all to consider about that 4th elementary school. And I think in short order, we'll be able to say, you know, what models might look like at the middle school, high school. I also want to say some of these changes are also subject to bargaining. So I want to be conscious of that as well. Some of the factors are and some of the factors aren't.
So when you say short order and ready now, are you does that mean next week, right? This time next week, which is verging on a national, I guess that I don't know if any of us are going, you know, taking vacation over the Independence Day holiday, but you know, is that next week? Is it the week after? I think that's what would be good to try to get to.
I think if it's a week from now, I may regret this statement. I think I could do it. I think people would just have to be conscious that the level of detail, like if you look at what other communities are coming out with, it's perhaps not at the level of detail that I think we've typically worked at in the past between the committee and myself. But it's certainly, I feel like it's doable to do towards the end of next week with, you know, what I think is feasible and why. But the 6 feet is really the helpful piece that I need. Now that I have that clarity, it just makes some things possible and some things not possible.
So when we talk also about town halls, thank you, Ms. Seeker. If we look at late next week, so that could be the 2nd of July, does that sort of looking at the week of the 6th potentially for virtual town halls, or is that the week of the 13th? And sort of thinking with the idea of, you know, how late in July do we want to sort of be pushing this? Ms. Dancer and then Ms. Spitzer.
I would support meeting next week to hear what Dr. Morris has to say, because, then arranging something to go out to the public, you're looking now at least a couple of weeks, which is getting us into maybe a week into July. So it seems to me we really need, if he really can bring that presentation, we should do it.
Ms. Spitzer?
I was going to just say the same thing. I think if possible to do it as soon as we can.
Yeah. I mean, I think it's definitely something we can do. Again, it won't have probably rightfully, you may all agree that it doesn't have the level of detail that sometimes I put too much detail in, but I think it'll have enough to give you a picture of what's possible and some backup data to support that.
Great. Which then sort of segues into our the two bullet points on our list sort of all like interact, because we can't talk about sort of further down the line without talking about how we're going to engage community and staff in sort of being able to provide more input and as we make a decision. So I liked the way, Ms. Stancer, you framed that in terms of getting something out to the community is after we are looking at the space options next week, end of next week, and maybe sort of preparing something from there that is maybe more concise than what we're looking at in terms of laying out the information and sort of the various options that we're looking at, and then talking about ways that we want to be getting more input and conversation from both families as well as staff and educators. And Dr. Morris talked about the virtual town halls. We've been doing those sort of throughout the latter part of the school year with some success, I think, and engagement there. And so I think that was the model that had been proposed for those town halls. So I guess the question is in terms of timing of that, should we be looking for just right after that meeting? So if we're meeting on the 2nd, should we be looking at literally the week of the 6th for scheduling a few of those? I'm seeing some nodding heads. Being ready for those. So I think, looking at that schedule. And then the question is when do we want to come back? I think it'd be helpful if we sort of put a stake in the ground of when we would like to come back, reviewing all of the feedback and conversations that we've been having with staff and community, when we would like to sort of discuss that learning and potentially come to a decision for on those models. And again, sort of back to Mr. Demling's comments, is sort of trying to balance moving quickly with not too quickly, right? So allowing us the time to marinate, hear, and connect with the community, so that we're certain that we're hearing from a variety of constituencies and stakeholders in our communities. Does that look like sort of the following, maybe the week, the 16th, if we're staying with Thursdays, as a time to come back together and review and discuss, potentially vote on a model? Or do people feel that's too quick? I'd love to hear some other people speak. Mr. Demling.
Yeah, I mean, I think not knowing where we're going to be, obviously, not knowing what we're going to hear, I think it's good to hedge our bets and schedule that meeting. And then if we feel it's premature and we need another meeting, we can have another meeting. It's obviously impossible if we wait until the 23rd to then have a meeting on the 16th. So, better to be conservative, I guess, in terms of like expecting potentially more meetings, and we could just, we can have the time if we need it, as opposed to waiting.
Ms. Hall.
Yes, I agree. I think kind of the sooner the better with everything. We're never going to arrive at a place where we have perfect information, so we might as well plan a timeline as best we can and be flexible when necessary. So I think we should go with it.
Any other thoughts, ideas from Ms. Spitzer?
Just a planning question, since I've kind of planned my life around having Tuesdays being the school committee meeting day. Is there a reason we are switching over to Thursday? And if not, is there any reason we could eventually, I'm not saying we get back to the 30th, because I'm saying that's very soon, but kind of after we do the town halls, is there a reason we couldn't get back to Tuesdays? I may not.
That's a good question. So would the 14th be sort of feasible in people's minds? Seeing nodding heads and thumbs up. Good. Great. Okay, I feel like we have good direction on a plan. Are there any other ideas, thoughts that anybody hasn't spoken that they'd like to say? No? Okay. And I guess, does somebody from the Amherst School Committee like to make a motion? Oh, Ms. Stancer before.
I think we have some gifts tacked on at the very end of the packet. Weren't there some gifts?
Yes, I think those are for the region. So
Oh,
we're
okay.
going to try to do 2 committees and the 3rd committee stay.
I move that the Amherst School Committee adjourn.
Second.
Moved by Lord and seconded by Demling. There's no discussion. Mr. Demling.
Demling, aye.
Ms. Spitzer.
Spitzer, aye.
Ms. Lord.
Lord, aye.
Mr. Harrington.
Harrington, aye.
And McDonald, aye. The Amherst School Committee is now adjourned. And I'll turn it over to Ms. Hall.
Thank you. Would anyone from the Pelham School Committee like to make a motion to adjourn?
I move to adjourn the meeting for the Pelham School Committee.
Second.
Okay. Second. All right. No discussion. Okay. Ms. Kenny.
Kenny, aye.
Ms. Jean-Louis.
Jean-Louis, aye.
Mr. Menino.
Menino, aye.
Ms. Stancer. Margaret, you're on mute.
Sorry.
That's okay.
Stancer, aye.
Thank you. And Hall, aye. Oh, Dr. Morris, you're on mute too.
Before Pelham adjourns, I mean, you're adjourned, but before you go, I believe this is actually Ms. Jean-Louis' last meeting. I've said that like 4 times now. For your extended service. I know your town meeting and election are soon. Hopefully before next Thursday. I don't know exactly when it is. If it is your last, congratulations.
Yep. Jesse, don't hate me. It is also Jesse's birthday today. So
happy birthday.
I don't know if it's doubly awesome or doubly terrible.
Well, congratulations on 2 fronts then.
And good luck to you all.
Happy birthday.
All right. Good night, everybody.
Good night. And so now for the region, we do have some gifts.
That's helpful.
Ms. Spitzer.
Right. I'd be happy to make the motion. So I move that the Amherst School Committee accept the following gifts from Dean's Beans Organic Coffee Company, number 13474, to support the district school meals program in the amount of $2,000. From Lucia Spiro, number 7136, to support the Amherst Regional High School Performing Arts Department in memory of Trudy Bauer in the amount of $60. From Stop and Shop A+ Rewards, number 8299785, to the high school at to support the high school at the principal's discretion in the amount of $8,583.43. From Anonymous, number 5602004883, to support the middle school at the principal's discretion in the amount of $10. From Anonymous, number 5601987592, to support the arms school at the principal's discretion in the amount of $10. And finally, from anonymous number 560-204-6676, to arms at the principal's discretion in the amount of $10 for a total amount of $10,673.43.
Second.
Moved by Spitzer, seconded by Demling. Any questions or comments? I'm not seeing anybody. I think everybody froze. Can you
Mr. Morris or Dr. Morris?
Mike is good at this time of night, right? But I believe, I might have missed it, but I believe Ms. Spitzer made the motion for the Amherst School Committee to accept the gifts. And so I obviously can't, but if someone makes a friendly amendment, I'm guessing Ms. Spitzer would accept it.
Mr. Demling.
I would be happy to offer a friendly amendment to Ms. Spitzer that the Amherst Pelham Regional School Committee accept the gifts.
Accept that amendment.
Any further, any questions, comments? Discussion? No. Seeing none, we'll now move to a vote. Ms. Spitzer.
Spitzer, aye.
Ms. Stancer.
Stancer, aye.
Mr. Menino.
Menino, aye.
Ms. Lord.
Lord, aye.
Whoops, everybody just switched places. Mr. Demling.
Demling, aye.
Mr. Harrington.
Harrington, aye.
McDonald, aye. Did I get everybody? Did I skip anybody?
Sullivan, aye.
Oh. Thank you. You're a black square, so I couldn't tell. Thank you. So the motion passes 8-0 with Ms. Seeger is absent. Good.
And move to adjourn the Amherst Regional School Committee.
Second.
Or second. Oh,
Moved by Spitzer, seconded by Harrington, and there's no discussion. Move to a vote. Mr. Menino.
Menino, aye.
Ms. Stancer.
Stancer, aye.
Ms. Lord.
Lord, aye.
Ms. Spitzer.
Spitzer, aye.
Mr. Harrington.
Harrington, aye.
Mr. Demling.
Demling, aye.
Mr. Sullivan.
Sullivan, aye.
And McDonald, aye. We are adjourned. Thank you, everybody.
Goodbye.
Bye.